Good evening, councillors, ladies and gentlemen, members of the public. Welcome to today's meeting. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photographing, making an audio recording and providing commentary on proceedings. Please note this meeting is recorded and streamed live. These recordings are published on the relevant meeting page of the Council's website. By choosing to attend this public meeting, you're deemed to have given your consent to being filmed or recorded and for any footage to be broadcast or published. If the alarm sounds, the premises must be evacuated immediately. Do not spend time collecting personal belongings. All emergency escape routes are clearly signed. Once you have left the building, the assembly point is in the High Street opposite the Guildhall. Members and other speakers are reminded to use their microphone when speaking. I am planning to have a comfort break around 10 to 9. Depending on how things go. If members feel they need one earlier, please do say, and we'll try to accommodate that. Agenda item 1 is appointment of substitutes. Julian, do we have any substitutes?
Thank you, Chair. The answer is no. We haven't got any substitutes tonight.
Thank you. Agenda item 2 is declaration of interest. Do we have any declaration of interest around the room? Councillor Holmes?
Just that I'm a member of Freedom Leisure, but...
Yeah, thank you. I think majority of us used Freedom Leisure at some point. Councillor Lawrenson?
Yeah, I want to declare that I work for a housing organisation called Sanctuary.
Okay, thank you, Councillor Lawrenson. So, any others? Fine. Do we have agenda item 3, public participation? None. Fine. Moving on to agenda item 4, the minutes. I believe Councillor Mace has raised some questions on some minor points. Julian?
Thank you, Chair. Yeah, I am indebted to Councillor Mace because he did spot some typos in the minutes of the last meeting. So I'll just explain what they are and hopefully you can agree the minutes as a correct record subject to those amendments. On page 2, in the second paragraph, you can see the words safer neighbourhood teams. It should say he commented on the work of the safer neighbourhood teams, otherwise it doesn't make sense. And then on page 4, the first paragraph, the penultimate line should say following the change to the way in which the initiative is provided. I missed some words out there, so I can only apologise. That's both typographical errors.
Thank you, Julian. Shall we go through them by page, if anybody else has got any items to query? So page 1, page 2, page 3, page 4, and page 5. Councillor Amos?
Yeah, thank you, Chair. Just one point on the minutes for clarification or correction, then a point of order. If I, perhaps with your permission, if I take them together, they're part of the same thing, if that's acceptable to you. Yeah, okay. Well, it's just on the last paragraph in brackets, except the item under discussion, which was, as you know, considered in secret in part 2, and it says exempt. And the first bit, not for publication, because the item refers to information relating to the financial or business affairs. Sorry about that, chap. Relating to the financial or business affairs of any particular person, including the authority holding that information. Then it goes on to paragraph 3, and because it contains confidential information given to the council by a government department. Now, my understanding is very clear that the reason we had to discuss it in secret, Chair, was for that bit where it says paragraph 3, after paragraph 3, because it contains confidential information given to the council by a government department. It was not because for any other reason. So what I'm saying is, I think it would be better if the minute reflected the reason why it was in part 2 in secret, rather than just, you know, a general discussion shoving everything in. It was because the government said we couldn't discuss it in public.
That's a valid point, Councillor Amos.
Thank you, Chair. And on that, my point of order, then following on from that, just to keep it clear, Chair, is why we had a discussion last time, if I recall, about this. But I asked a question. I think the committee generally accepted my concern as well, as to why we were discussing this in confidence. The government's asked us to do that, and obviously we have to respect that. But I can't, my concern, Chair, is this. For the item, you know, dispersing hundreds of asylum seekers in Worcester, accommodating them, given the report we've got on housing later, is a very big issue for the people of Worcester. So my concern is the reason for the secrecy because London bureaucrats, or whoever they are, think that the people of Worcester are either too stupid or irrelevant to be allowed to know what's going on in their city? Or is there some other reason why it's secret? I think that's my concern, Chair.
Lord,
Chair, I can only direct Councillor Amos to the advice that was provided at committee and at council, and we'll continue to keep members briefed on the subject.
thank you.
Yeah, I think your look, Chair, was, I think, met mine, which is that my question hasn't been answered. All I'm asking for is the reason why we have to discuss this issue in secret so the people of Worcester don't know what we're talking about. What is the secrecy about dispersing hundreds of people who have got to be accommodated in Worcester? It's a matter of public concern, Chair, a matter of public interest, whatever view we have on it. Why can't we discuss it in public? That's my question. There must be a reason.
Yeah, thank you, Councillor Amos. You've made your point. And that's not an item for discussion on this agenda today, so we can take that offline and try to get off an answer from officers in terms of trying to delving into that question. Thank you. Can we move on to question? The item is not up for discussion.
Just on part two today, Chair.
This is an order of minutes that we're talking about, a process for minutes. So we're not debating an item, or we're not debating the original question that you've asked has been answered in terms of the clarification that's needed. We're not debating the reason why these things are on there or not in terms of that, because that opens up to a wider discussion, which is not an item, an agenda item on this committee.
But there is
we'll move on to. Thank you, Councillor
Part two, though, Chair.
Thank you, Councillor Amos. We'll move on now. Agenda item 5, then. Can I welcome? I think I've got Rob. Is that Rob Tyler and Adele? Is that right? Yep, Adele Hodges to the table in terms of presenting that. This is the Freedom Leisure Contract Year 8 Annual Report, April 23 to March 24.
Good evening, everybody. I can't believe it's been 12 months again since I've been back here, how time flies. So let's just try and get this, there we go. The presentation set up. Cool. Okay, so yeah, we'll get straight into the presentation. Just a little bit about the background of Freedom Leisure for those of you that might not be fully aware. So Freedom Leisure, we operate over 130 centres now throughout the UK, with the majority of those being leisure centres, but also community centres, museums and theatres. And we operate those on behalf of local authorities throughout the UK and charitable trusts. We are a not-for-profit organisation that reinvests our surpluses back into the local communities. Our core mission and why we exist as an organisation is to improve lives through leisure. Okay. And as you can see here, here's our end-of-year accounts for last financial year. So we finished the year with a break-even position. Included within the accounts are the utility costs for the year of £545,000. The implications of the increased tariffs for that year were £292,000 more than the previous year. So there was a significant cost pressure there for us. Financial support was provided by Worcester City Council and gratefully received, and we thank you for that. And the financial support provided was £189,000. Within the accounts, we provided the council with an annual management fee of £792,000 for the year. Without interventions such as a staffing restructure, energy reduction plans, and the hard work from our dedicated colleagues, the need for further financial support could have been greater. Without the increase in utility costs, the partnership would have actually made a surplus of £100,000, which would have been obviously even better than the break-even position. Okay, and as you can see here on the screen, we really do care about the environment. So looking back through our journey since pre-pandemic, our performance for utilities has been really successful. So last year, we reduced our electricity consumption by 84,000 kilowatts compared to the pre-pandemic. We saw a total reduction of 52% on gas, which equates to over 1 million kilowatts. In recent years, we've saved enough electricity to supply 32 average UK homes for an entire year, with enough gas to supply 108 UK homes for an entire year. And looking at St John's Sports Centre, another really good performance. We saw a 46% reduction in electricity usage and a 37% reduction in gas usage. Across the contract, we've saved in excess of 1,750 tonnes of CO2 emissions since 2018. More recently, we've supported the council with obtaining the Government Swimming Support Fund, which is £195,000 to improve the energy at Purd as well, with the solar panels going on the roof, and an upgrade to the building management system. As part of that funding agreement, we were required to undertake an environmental management audit, which took place back in July. We achieved a high score of 90% and a mention of exemplary environmental practices and initiatives. We've maintained our ISO 14001 certification, which includes all of our Worcester sites. We've recently taken on a corporate responsibility and sustainability practitioner apprenticeship, which is able now to support our local contract. We are now working with the Windheim University of Applied Sciences, who are a group that have come over from the Netherlands, and they're based in Worcester. They will be looking at sustainable development, future technologies to achieve our net zero ambitions, and we'll be looking at social and behavioural changes that we need to make that happen. So the students are currently based in Worcester, and throughout the next few weeks up until Christmas, they're utilising the offices at Purd as well. And we've got a co-creation workshop with the council's sustainability team. Okay, we are the first leisure operator to become an accredited carbon literate organisation. We've purchased the licence for the accredited carbon literacy course for charities and social enterprises working in public leisure, and we have begun in-house carbon literacy training for our workforce. So we have over 70 colleagues throughout the organisation certified, including our CEO and senior managers across the business. So I've myself gone through that course very recently, and so have the general managers within our centres within the contract. And we'll be looking to scale that out now to bring our colleagues on the journey with us. On Thursday, the 14th of November, so we are participating in Carbon Literacy Action Day. So this is the world's largest climate and education training event, coincided with the COP29. So the Action Day will see the largest number of people from all corners of the globe, simultaneously completing the carbon literacy training. So during last year at Purd as well, we undertook a Quest assessment. So Quest is widely recognised as the industry standard benchmark for leisure facilities in the UK. The Quest assessment evaluates various aspects of the operation to ensure high standards in service and performance. At Purd as well, we excelled in numerous areas and received praise throughout. Out of the 11 modules, 6 of those were deemed as excellent and 5 were deemed as very good. And some of the modules that we covered were tackling health inequalities, managing the team, environmental management, and sports development, just to name a few. Swim school. At the end of the year, there were 2,380 children and adults on our swimming lesson programme. Looking at the growth that we've had since we took on the new Purd as well back in 2017, we've grown the programme by 1,676 members. 24 schools now take part in regular swimming, an increase of 4 from the previous year. And we've invested £10,000 in teacher training, including CPDs and Swim England courses, to support with our ongoing development. Membership data. Whilst our membership numbers and headcount went backwards last year by 66, I'm delighted to give you an update as to where we're at the moment. We've actually grown the membership base by 280 since the start of April. We're now on 5,385 members, just 1% short of where we were pre-pandemic. So we've essentially now, not quite, but 1%, we've fully recovered from the pandemic, which is a really positive achievement for us, one we're really proud of. And the last slide before I hand over to Adele, participation. We saw 696,000 active visits within the leisure centres, seeing us exceed our target. And we saw a 15% increase in participation compared to the previous year. And I will now hand over to Adele, who will continue the presentation, just give us an update on our Healthy Communities programmes and direction of travel. So it's on the right one, and then yeah, just press that every time.
Thank you. Can you hear me through the microphone okay? Brilliant, thank you. Yes, so I'm Adele. Thank you. This is my first communities meeting, so I'm really glad to be here. I'm the Healthy Communities Manager for Freedom Leisure for Worcester City, but also Malvern Hills District as well, which is important, and I'll share why as we go through. I think to preface the rest of the presentation, it's really important to share with you that in the last few years, we've actually changed our position with the sector slightly. So you will know from previous that there was a leisure standard that was sport for sport's sake. It was all about developing people's abilities within a sport and how good they could be. Well, we're shifting that slightly. It's called the Pivot to Wellness, and following strategists like Sport England, we're looking at going along that pivot to active wellbeing journey. So we now view ourselves to be in a position whereby we can provide a preventative or a reconditioning upstream approach for reducing the crisis care required by the NHS. So we're trying to see what leisure can do, what physical activity can do to support our healthcare systems. And we're looking to do that in a number of ways, but really broadly speaking, in a way that I could fit it onto one slide, we're looking at positively impacting population health, we're looking at reducing health inequalities, and we're looking at ultimately reducing inactivity. So with all of that in mind, I wanted to share some success from previous, but throughout the presentation, I'll start to talk about what's kind of happening now too. A lot of the work to get us to that position of strategy was done in that last year. So some key highlights, you can see that we achieved over 13,000 active participations. It's really important to note that with this new focus and strategy, sometimes we'll deliver to less people, but we'll be making a much greater impact, because what we're doing is we're laser beaming our focus and supporting those that most need it in many cases. And we're really proud of that actually. Enabling us to do that, we were successful in a number of funding grants, and in fact, we achieved over £50,000 worth of funding. And that is on top of the successful, sustained programs whereby we generate very small income because they are low cost by design, but they generate enough to sustain themselves to continue going. We also engage with a range of demographics, and actually I'm really pleased to be able to tell you that that is a much greater number now, and we're reaching out to far many more communities since this presentation would have come to you when we're talking about the last year. And some of the highlights based on receiving that funding enabled us to do things like feed families and children that otherwise might not have had access. So when we talk about that strategy change, sometimes it's physical activity, sometimes it's being a platform, and sometimes it's using our facilities to enable better health and well-being of our community. That's what it is at the heart of it. We also developed a program called the Talented Athlete Program. We brought it to Worcester City. That is about recognising and supporting our local champions that are successful in sport, because that has a part to play. The reason we have done that is because we want it to be an opportunity to inspire and motivate, especially our young people. So we're really pleased to have done that. And we have 5, in fact, as of this week, 6 on our Talented Athlete Programme. Thank you. Can't multitask. There we go. So we can't achieve any of the things that we're trying to do without collaboration and partnership work. And it's really important that we share the success, because actually in this last year, what we managed to do was embed ourselves into the wider ecosystem of health and wellbeing in a far better way than we had done previous. When I talk about collaboration, for us, it's really important that that's done at every part of the journey. So not just in delivery, not just in marketing, but in design, in consultation, data sharing at the end, making sure that we're learning from the other services that are working in the area and co-collaborating and designing to make the products that we deliver far more beneficial to our community. With that in mind, we're especially proud to share that we are now part of the District Collaborative, which is often held in this room, so I feel slightly more at home. As well as the county-wide Being Well Strategic Network Group, amongst many others, such as the Dementia Action Alliance, youth collaborations, and the list goes on. If we don't physically attend, we do make sure we receive the notes, because the detail that's provided is really poignant to how we design our programming and our work. You can also see a list on the board here of some of the partners that we've worked with. That list has grown drastically this financial year already, so I can't wait to come back and show you what we've done this year next time. Thank you, Rob. So on the board, I thought it was probably quite important that I shared with you that there's a lot of sustained and ongoing programs. So not only are we developing new and working in a new light, we're making sure that the work that we were doing continues. And this is just a list of some of them. So walking sports, and I won't list them all, but you've got netball and football and cricket and so on, which is an active ageing provision. We've got mini youth, which is community-based delivery in some of our lower socio-economic areas, working with Worcester Community Trust. We have a lot of special educational needs and disability provisions. I've listed a couple, but the Monday Night Club, which I have a lovely case study to share with you. ASPI, which is a football session. We have SEND-specific Learn to Swim projects, and many more to come. And then additionally there, we have a lot of gym-based classes. Something that we've been very successful in doing in that financial year was embedding our healthy communities concept amongst the facilities. So I think previously healthy communities or active communities would work quite separately. We are fully integrated into those facilities, and we know that customers, members, our community will more than often at some point in their journey need some support. So we're embedding that culture into the programs that we deliver at those sites as well. Thank you. So I've got a few case studies to share. The first one is Active Workforce Week. This was a campaign that we delivered in partnership with the Active Herefordshire and Worcestershire, with Worcester Primary Care Network and the GP and clinical practitioners and the team there, Citizens Advice and Worcester City Council. This was a campaign that sought to support Worcestershire employers, understanding that workforce health was high in the agenda, and we've seen that grow and grow, and more programs have come as a result of it. Ultimately, what this campaign did was reach out to employers. You can see on the board we reached 42, which was a really good win for us. We thought that was brilliant. And we supported them with information, holistic information, as to how they can support their colleagues to be well. That included direct key health messages from the clinical practitioners, such as stopping smoking. It included things like screening appointments and ensuring that colleagues were aware of the necessity of them. But it also included a 7-day free pass at our facilities with additional physical activity support and drop-in sessions with social prescribers within those buildings. So it was about saying to businesses, you have a relationship with your colleagues, use it and use it to tell them how they can improve their well-being. So it was a really successful campaign, and we will seek to do it again, and we'll look forward to doing so. The next case study I have to share is the Holiday Activity and Food Funded Programme. In the last financial year, we delivered over 600 meals to young people. What that meant was we were able to deliver across Purdeswell and St John's sessions a number of masterclasses with local sports clubs and providers that could provide links into other existing sessions. So young people would come to one of those sites. They would take part in a multi-skills camp that included things like how to be a leader, how to build healthy habits, all in a very fun, wrapped up way that meant they were also kicking a ball or shooting a net or whatever it is they might have been doing. That programme is developed. We now bring in subcontractors such as Worcestershire Cricket Foundation and others. And what that does is it means that young people who maybe don't want to use the gym or don't want to learn to swim are still being active in the way that seeks right for them. So we're really pleased that that has worked so well, and so well that we've delivered it a number of times since again. Next case study is the Monday Night Club. So this is a project delivered in partnership with the Monday Night Clubbers and Disability Sport Worcestershire. We are funded to deliver an adapted football session that enables a group of young people to be able to partake in football and physical activity and social engagement once a week. It's delivered at St John's Sports Centre on the AstroTurf. It sees between 10 and 20 people each week, but this has also led to us having further conversations with the FA. What we've now done is start a conversation around whether there's a plausibility to bring the Disability League to Worcester City. So we're really excited about what that might look like and what we can share with you next time. The next case study, I won't talk, it's a video, so I'll let it do the talking for me. So that's a great programme that's been around for a while and has continued to grow. It's in partnership with England Netball, the active partnership, but also with Age UK, who provide a direct referral pathway into that session, not because they want more people to move more, but because they want a safe space for them to be socially active, reducing social isolation and loneliness. The physical activity is the cherry on the top. So the next slide is around tennis, and the highlights for tennis lend to the exceeding of the target of free provision. We achieved that number, so 1,509 active participations, through a number of different programmes. It was the multi-sports provision that had a tennis arm to it, so we would deliver multi-sports in the parks but tennis provision on the courts. We had park specifics provision, and this year, we've also worked with Love Parks to develop on those courts too, which have been really positive. And then we also delivered a workforce scheme, which was working with partners that we'd already engaged with to further that workforce health consideration. And then lastly, we of course worked with you guys at Worcester City Council to deliver the Wimbledon programme, which was again positive and a success of 70 more participations than the previous year. And again, we've seen more this financial year, so growing as we go. Now, I'd like to talk about the future. So we have been working on what we'd like to call, it's not a strategy and it's not a plan, but it will be, and we will share it with you, but it's our vision for now, it's our journey, and that is how we consider our facilities. So we would like to consider them as a hub for wellbeing, but what does that mean? I said before about considering the fact that I work in Malvern Hills and Worcester City. Well, the reason, the importance for that is the geographical footprint that you can see on the presentation. Many of our residents, Worcester City and Malvern Hills alike, will live really close to a Worcester City facility or a Malvern Hills facility, but will actually reside in the opposite location. For us, we want to widespread the access to wellbeing as far as possible. So we have designed this vision to be beneficial for both of those contracts so they're not competing. So what is a hub for wellbeing? Ultimately, it is considering wellness holistically, so no longer just sport, as I said, but it's thinking about physical wellness, mental wellness, and financial wellness. They are safe spaces that are welcoming, whereby people can access information, signposting, and sometimes referrals into our own, but also other services that we're connecting with. They are a safe space, again, that the community can build independent wellbeing. We know the NHS has this as a priority based on once a person has received the intervention that they require, how do they continue to live well independently? So we're looking to ensure that's embedded into our culture. Furthermore, it's a space to bring people together, reducing isolation and loneliness and building friendships, a space to access health-specific interventions, and of course, not forgetting a space to be physically active too. That's a bold move away from stereotypical leisure, but it's one that we're really excited to be working on towards that active well-being. We're going to achieve that through 4 different approaches. So the first is workforce, which is ultimately upskilling our colleagues outside of their usual realm. So not just fitness instructors, not just receptionists, not just lifeguards, but colleagues who have got the ability to speak about well-being and hold safe conversations. We'd like to consider ourselves to be a welcoming, knowledgeable front door, a concierge service, if you will, to wellness. The idea is that understanding the multifaceted needs that our community face, asking them just to be active does not work. So enabling our colleagues to be able to hold safe conversations, understanding the barriers that they might have in place, and the responsibility that we could have to different wellness barriers, we'd like to be able to develop the provision. So some examples of that so far that we've already achieved is the Cut It Out training, which is a domestic abuse campaign. We have the orange button, and I'm wearing mine today, which is suicide prevention and dementia friends training. What we've also done outside of developing those training opportunities, and we'll be seeking more, is invite partners to partner briefings, whereby senior managers will receive updates on things that they're doing within their service. Our first service will be Action for Children, who will be talking to us about parent conflict, how to access vitamins, and many more. The next section is health-specific provisions, and that is ultimately projects specifically tailored to bolstering healthcare services. So that could be, and I've listed a few on the board, exercise on referral. We've already agreed with the primary care network that we'll start to develop that as an offer in Worcester City, hopefully next financial year. And we're also working with Worcester Oncology Department and Macmillan to look at a cancer rehabilitation option as well as anti- and postnatal mental health swims and many other more. The next option is connecting residents to services. So that is ultimately, given our connections within the city and the services and partners that we're working with, we want to make sure that our customers and our members and our community also benefit from that knowledge as well. And we're going to do that in a few different ways, but I've listed a couple, which is our quarterly health newsletter, co-location, and platforms as well. And then lastly, it's being active, which is our bread and butter, and you know plenty of. So what's in the pipeline, and I'll wrap it up quickly. Recently, we've launched Born to Move, which is a partnership with Les Mills that enables us to provide free access to virtual exercise classes for schools, youth clubs and other settings. So if you know any, get them to get in touch. Mummy and Me, which is a postnatal session designed for mums to remain active without the barrier of childcare. We've developed Mini Splash, which is an active play session in partnership with Action for Children designed to build confidence and introduce physical activity and play at an earlier onset with a family whole approach. We've continued multi-sports, but this financial year, we've been doing it with targeted provisions. So we're working directly with Worcestershire Fostering to do closed sessions, but we've also worked with Worcester Community Youth to make sure that we're delivering in IMD 1, 2 and 3 areas. And then of course Summer Quest, which I'm sure, hope you'll all have heard of, which was an online platform to engage community with services while being physically active and having fun across the summer holidays. There's lots more coming soon.
Have to wait.
That's
Until next
it.
year.
Till next year, there you go. But thank you, thanks for having me.
Kind of speechless. To be honest with you, I mean, it's the first time, I think, in a number of years that I've chaired this committee that you've given me some optimism in terms of actually translating some of the vision a lot of our councillors have in terms of Freedom Leisure's role within our communities. So I you know, obviously I'll open it up to the floor in terms of that, but really optimistic and hopeful for the future in terms of the programme that you're running. So who can I have speakers from the floor? I'll open it up then, please. Councillor Sarah.
Thank you, Chair. I was wondering if I could ask a little bit more about the community partnership element. And I believe we met at the coffee session, and I asked you if you had got yet an active cooperation with what used to be Worcester Play. I think it's a slightly different name now. And can you tell me what the status of that is, please?
So in the last financial year, we delivered collectively on the multi-sports provision. So we would pitch up in the same places and then they would deliver the play side and we deliver the physical activity side. So we've developed some provision there already. Most recently, we met with the new chair and Councillor Kate Collier to discuss how we can move that forwards. And I'm pleased to share that my colleague Gemma will be attending their next board meeting to see how that relationship can continue.
Thank you for that. Yeah, I think there are many opportunities that have left, sort of languished in previous years. So I'd just like to encourage you to be very dynamic about forging that for the future. Thank you.
Thank you. We've got Councillor Holmes.
Well, I suppose I could, but everybody else has to hear. I hate to be negative, and I don't want to be. I'm hoping there's a positive answer. I noticed that the figures have gone down for the Northwick, not Northwick, the Nunnery Wood Sports Centre. Do you know what's happened there, and is a recovery plan? Because that's very close to these school sports facilities, and we have made a couple of attempts with as a city to try and bolster that, and the presence of a sports centre there is kind of important. So I was just wondering if you knew what had happened.
Yeah, it's a really good question, and I presume you're talking about the usage, the active participation. Yeah, it's a good question. So last year was the first year where we changed the operating hours up at Nunnery Wood, which was required in order to reduce our costs as a result of the utility crisis. So that's something that we worked on in partnership with the council and SLC, Senior Leisure Consultants, and we found that was an opportunity for us to, again, reduce costs to ensure that we're viable moving forward. So I think that's part of the reason. And I believe there was also some extended exam periods which took away some of the spaces. I think that would have played a part as well. But we're absolutely committed up at Nunnery Wood to driving the classes forward, utilising the outdoor spaces where we can. And the membership numbers are beginning to grow again. We've had a good start to this year. So yeah, long may that continue. But it's really important for us, Nunnery Wood, as a site.
Yeah, thank thank you. Because, I mean, it was quite obviously, you know, the one thing that was, and everything else I was really impressed with. And it was like, oh.
Yeah, thank you, Councillor Holmes. I think that's reflected some comments from our side as well in terms of Nunley Wood and where that places in there in terms of, I suppose, the reduced number of hours there, and just obviously it's reassuring to hear that the commitment regarding Nunley Wood. Obviously, it is a dated facility now, so hopefully you can work with the City Council in terms of seeing what other offer that we can bring in and around there. I'll take Councillor Mace next, please.
Okay, thank you, and thank you to officers and Ben and Adele for the report and all the work on that. Thank you for the coffee morning at the Leisure Centre, or coffee afternoon at the Leisure Centre as well, to look at the facilities. That was very educational. I wanted to say well done for saving the 565 tonnes of CO2 in the last year. That's excellent progress, and obviously the solar panels that are going on the roof at Bird as well are going to make a big impact on our path to net zero by 2030. I would be very supportive of any project that could come forward to replace the gas boilers with heat pumps, as they've done with in Evesham, because again, with the solar panels on site, that could substantially reduce our CO2 output. Now, I did want to raise the lifts at Purdswell Leisure Centre. I did notice on the coffee afternoon that both of the lifts were out of order at the time. Now, I know one was out of order since May 2023 when there was an accident, and the second one had been out of order since September, and one is now back in action of this week. But over a month and a half of both lifts being out of action is not great. That means disabled users could not access the gym for all of that time. I want to say thank you to Alan New for giving me the disabled access information and letting me know that disabled users could use the centres at St John's and Nunnery for free. But for my residents in St Stephen, that's certainly a lot less convenient because the leisure centre is right on the border with the ward. So they would have to use a car in a lot of cases to get there, whereas they weren't able to, or wouldn't have needed to get to Purdswell. So my big concern is the amount of time that those lifts were out of action. You know, having had one for 18 months not working, that leaves you to any problems that happen. You know, then there's no access at all to the gym. So I would certainly be, I would expect kind of any issues that are preventing able-bodied people would have been dealt with a lot quicker. So I would hope that we could deal with those issues a lot quicker in future, please.
Yeah, Rob, do you want to come back on that?
Yeah, again, yeah, thank you. I'm pleased to report that one lift, like Alan said, is back open now. It's just frustrating for, obviously, the customers with the disabilities. It is for us. We've reached out to the customers that have disabilities, and we've provided them alternative solutions throughout the last month and a half. And again, we've just apologised for the delay in that, and we've been actively pushing in the background with our contractors for a speedy resolution, but absolutely, yeah, noted.
Thank you. Councillor Ali, and then I've got Councillor Lawrence and then Councillor Rudge.
Thank you, Chair. Thank you for the presentation. Could you please provide some information about the ladies-only swimming session? I believe it's on Sunday. How is that going, and is there demand to increase the hours? That's my first question. And the second question is about school swimming, not the swim school you provide directly with the kids from year 6 coming to the centres. How effective are those lessons? Do students learn how to swim during those sessions, or do they just spend time in warm water? Or if they do learn to swim, do they get or receive qualification for that? Thank you.
Cool. So I'd have to go and get you the official statistics on the uptake of the ladies only swimming, but what I can share is that I know there's been interest for lessons within those sessions. So initially when it was first developed, it was developed as an open swim in a private space. They ensured that it was only for women. But a lot of the barriers that were presented were actually that the women didn't know how to swim. So we're looking at how we can develop that into the programme as well. We're also aware that we've received a lot of feedback from a group at Worcester Community Trust around the times and days that it's being provided. And we understand that generically those days and times could be considered to be a barrier. But in order to provide it to be a safe space where it is genuinely women only, based on it being a mostly window building, that is our safest option to be able to provide, but we're always willing to look at other alternative options. In regards to effective school lessons, that's really interesting that you raise it, because I was having a conversation with our swim school lead recently. And yes, they ultimately do learn swimming skills. Key focuses can be around water safety, but yes, they learn skills. I can't answer the question about qualifications.
Not quite sure I understood the question about the qualifications. If you could, yeah, just maybe ask that one again.
Basically, if my kids were there and they did 2 years course and they did level 6, but my daughter, who is in year 6, going through school, she doesn't know how to swim. She just stays in water and she is not learning anything. That's my personal experience. When my son went through school, he already had swimming lessons. He was learning, he was enjoying it. But I have noticed my daughter isn't learning anything. She's enjoying water, staying in there, learning the safety bit, but she's not getting any qualification.
Yeah, so I'm actually in the process of writing a new programme, so I have some context that I can share on that. The project that we're developing is a corporate responsibility package, because what we're hoping to do is work with the businesses that we've already engaged with to provide opportunity to sponsor children and young people to be able to learn to swim for 12 months. That's based on meeting the need by Swim England's recommendation of being able to swim at least 25 metres, but also it came as a finding out of the HAF provision, which was a lot of children won't step foot in water outside of the lessons they go to with school. So we really understand that that's a barrier, which is why we're developing the programme. The school's lessons are not enough to be able to learn to swim competently, but they're a really good starting step. And that information you can find on both the RLSS and the Swim England websites.
And as well, just to sort of add to that, children on our Learn to Swim programme benefit from unlimited free swimming. So we really actively encourage families to come and access the pool outside of their swimming lesson times, which further boosts water confidence and technique and ability.
Yes, thank you. I've got a number of points to say on that. I think Councillor Woolmer was going to do a related point on this, so I'll bring you in before. All right.
Yeah, thank you. It was around the under 16s, the contract in paragraph 2.10 of the report, that there was free swimming to under 16s offered in priority wards. So I had two questions around it really. One was, how do you identify the children who may need that? And has it, been taken up to the level that we would expect? And also, I know that the national curriculum is that it's year 6 is the kind of benchmark of when children should be able to swim 25 metres. But is there an argument that that's actually quite late to be introducing children to swimming, and whether we should reconsider lowering that age group a little bit?
Just to give you a context before you reply, Adele, obviously that service level clause in the service level agreement is something that I put in a number of years ago as part of my experience from nearly drowning at the old Sansom Walk swimming pool in terms of that. And obviously the kids are assessing our kids' ability to swim. So if we're not capturing those and as Councillor Ali has highlighted, if kids are still escaping the net, do we need to, I think Councillor Bulmore's point is, do we need to interact and identify earlier, maybe year 4 or year 5, so they can then give sufficient time to enable them to reach that 25 metre sort of benchmark before they level 6. So that's the context I think we're framing that the question in from. That policy clause has been in for a number of years that we really haven't had a scrutiny of it or an assessment of how well that's working and how many people have been identified or helped as a result of it and how we've come to improved it. So I think that's the context.
So going to try and recapture that. I've been making notes so I can remember all of the questions as we go. So in regards to how we identify children in sort of low socioeconomic wards or priority wards, is ultimately done through IMD scope, which is the indices of multiple deprivation. And what we do is we work with both partners in those areas that are directly connecting with those young people and supporting them or their families, or we are connecting with the schools that are based in those areas and the schools are cascading that information. I will say that when we work with schools, it is loose, it's not referral based, it's they're welcome to put it in their newsletter and the children and families are welcome to make use of it. But we are aware that that then goes on lots of notice boards and it gets cascaded quite further. So in regards to reporting on it, we definitely could look at how we tighten up our referral or signpost pathway for that. One of the things that we've discussed before this meeting actually was developing like a signpost pathway that's a physical form. What we already do with a number of our partners, such as Citizens Advice, Age UK and many others, is we have a concession referral form. Well, we could duplicate and do the same thing, but for free swimming to enable it. So there's lots of different things that we could do. But I think you're right. We probably are not recording the data in the best way, and we could certainly look at improving that.
I think just to jump in there as well, I think absolutely we promote swimming lessons and we take children on as young as 3 months. So we're actively, advertising that, bringing children in from 3 months for swimming lessons. So we've got many examples where customers have gone through the whole entire journey, but it's just about reaching everybody, as many people as we possibly can. And did you want to just maybe highlight Mini Splash at this point? Because I think that's a good feeder.
Yeah, sure. So as part of the Best Start in Life subgroup, what we did is identify that there's a real lack in provision of physical activity for the early years, except from privatised and not very accessible or affordable opportunities, a lot of them being chains. So we've started to develop active play sessions, which are physical activity, play-based provisions. One of them is in the water, it's called Mini Splash, and the idea is that you can gain confidence, start to gain skills. It's not a swimming lesson. Actually, the guardians are guided as to what to do as opposed to teaching the children directly, but it's our starting point. I think the Best Start in Life group would probably advocate that the earlier that you learn or the earlier you start to be active, the better, because you build a healthy habit when you start at the start. So.
Thank you. Councillor Lawrenson, and then we've got Councillor Rudge.
Thank you, Chair. Questions about the accident reporting on page 29 of the version of the presentation. It just reminds me of a Steve Coogan sketch where he's a leisure centre manager and he's trying to explain away fatalities. Can you confirm that the one reportable accident is not a fatality? And what is the threshold for an accident becoming reportable? Because surely, by virtue of the 163 incidents being on that grid, they're reportable. So what is a reportable accident? And can you assure me that the one that we have included as reportable is not someone passing away? Thank you.
Okay, so yeah, I can confirm nobody has passed away on that one. So reportable incidents or accidents are something of a serious nature where an accident has taken place on site, where a customer or colleague has been administered to hospital essentially. So yeah, that's it. Yeah.
Thank you. Councillor Rudge.
Thank you, Chair. My question is whether you have any figures on how people access the leisure centres. And I'd be fascinated to know if you do, what they are. And the flip side to that is there anything you think the City Council can be doing to help people access? For example, Beryl bike bays on site, bus services altered possibly. I know it's not easy for us Warner villagers to get to Purcellswell by bus. It's extremely difficult. I don't know whether there's anything we can do.
Yeah. Just, I was really keen to jump in there because part of the carbon literacy training that I went on, we all had to make a pledge, and one of my pledges was around active travel, green travel. So that's something that I'm going to be leading on across the Worcester City contract, and part of that is reviewing transport for our customers. So that's something that I definitely would like to work on with the council. We've got the Beryl bikes in place and they've been really successful. We've got those up at St John's and Purd as well. But that's active travel. That's something that I definitely will be looking at over the coming months. Yeah, so willing to work with you on that and others.
If I may, Chair, you don't actually have figures at the moment. I'm just interested in whether the bike scheme, for example, has made a significant impact and whether we can do more of that, or whether the bus is something you've looked at and your figures suggest, well, hardly anybody's coming by bus and we need to do something, or you need to ask us to do something if we could. I know it's a difficult, thorny issue, but...
Well, I can give anecdotal, I can't give figures directly. There are a number of groups and demographics that we work with that transport is absolutely a barrier, and I'm sure it is for many of the services that they access. We've recently this week launched a session called Brighter Futures, which is for economically inactive young people to access mentoring support, as well as access to the facilities to improve their physical activity and well-being with connections to social prescribers. The barriers they're facing is, well, they're economically inactive, so they can't pay to catch the bus. So I'm aware there are schemes coming out around whether social prescribers can give away 3 minutes on the Beryl bikes, things like that. It's connecting the dots. But certainly there are some demographics that are challenged, such as the refugee group at Worcester City Welcomes. At the moment, they've got to make their way from the hotel across to the facilities. And for some of them, they have had to come quite far before they play a game of football, which certainly affects their game, they've told me. So yes, there are some demographics that are challenged. Yes, it is raised. But I think part of what we're really proud to be doing is taking our physical activity out into the community to try and reduce those barriers as much as possible.
Fantastic. And the final question I'll take from Councillor Wilmore before I sum up.
Thank you. I really enjoyed that presentation, but the bit at the end was the bit that I really wanted to hear more about. Around this, a complete change of emphasis around what the purpose is of a leisure sports centre, and that it is a space for the community in its entirety, and that health is physical, mental and social well-being, not just for physical health. How radical do you think you're going to be able to be with this? Because to have a hub that is somewhere where you can access not just a sport facility or an activity facility, but to have a chat with a physio about your OA knees, about to talk to a social prescriber about setting some goals, all the rest of it, because we can't underestimate the symbolic power that somewhere like a leisure centre has, and that people will just not even set foot in it because it's too intimidating. And the Chartered Society of Physiotherapy have run several campaigns over the years around, love activity, hate exercise, because you go to a sports centre and the barriers, the pictures around the front are somebody in a spin class, somebody doing body pump, and that in itself is a major off-put to people who are not used to exercising and who feel really intimidated to walk in. So if it's going to be this lovely hub of well-being that isn't overtly a leisure centre, what's your, how radical in your vision can you be? Do we rebrand it? Do we even call it a leisure centre or a sports centre anymore? Because that in itself suggests that it's something that is away from the vision that you say you've got. That would be
this
amazing.
is my favourite topic to talk about, so I'll try and keep it as concise as possible, but I will welcome anybody that wants to talk on it more to be in touch, and we can do another coffee afternoon and we can talk for hours on it. It's a journey, if I'm really transparent. We've had some success already in Malvern Hills. We co-located a family hub into one of the facilities, so the provision of stay away and plays and family parenting support is already happening from a leisure centre or what could be considered one. And we also have the MSK physiotherapy team from the NHS working from Malvern Splash. So those are some really key steps we can start taking in Worcester City. It's almost like a go where the energy is, because there is an argument to say that there are a lot of healthcare professionals that see value in physical activity, but goodness me, isn't it scary moving outside of a GP surgery? So there's a bit of work to do around that. Co-location is one point. The flip side to your argument of, for some people, the leisure centre is absolutely the wrong place, I can totally understand. Flip side to that is absolutely somebody's safe space. Currently, there's a really high proportion of male suicides, unfortunately, and there is also a large percentage of men that don't uptake their screening. We've got a lot of men that come to our facility and use the facilities, and we've got a rapport and a trusted voice with them. Why don't we do the screening there? So it's a platform too.
Thank you, and obviously I can sense the chemistry in the room between you two, and actually it might be something on the health and well-being agenda, right? In terms of that element of Freedom Report. I mean, so obviously at this point is to remote, but can I say fantastic? There's obviously a lot of good stuff in here in terms of that, and exactly the vision. I think all of our councillors have. The move from a city council perspective and from our administration's point of view has been people focused, and we've been banging on about that for the last couple of years, and so especially from a Labour administration. Obviously, from people from other parts of the understand that agenda now as well, and are clearly inputting Councillor Collier with a young champion, people's champions, and understands that and gets that from a play facility. You moving into our communities is what is kind of needed in the next centre, bringing it out to that and taking on those challenges. So really appreciate that in terms of that. So are we all happy to note the report? Cool. Fantastic. Thank you. And next agenda item is proposed fees and charges. Alan.
Thank you, Chair. So just to start off with the report at section 3 with the pricing rationale for 2025. Freedom Leisure employ a significant number of employees in the region of about 140 contracted staff, both full-time and part-time, and then a host of casual staff to support the services as well. And inevitably that represents, as you can see, about 50% of the cost base. And aligned to that, going back to some of the references that Rob made earlier, the significant increase in energy costs in recent years has meant that now represents about 15% of the cost base as well. And as a result of that, from Freedom's perspective, their costs have increased by 9%, but their income has only risen by 4%. So this process tonight of going through a review of the fees and charges is kind of really important in kind of being able to close up that gap. Now, as part of that, Freedom have implemented a pay award fairly recently. And the implication of doing that is that it doesn't necessarily just affect one line of the organisation. So again, within a structure, if you've got posts that are fairly closely aligned, once you make a change to the staffing costs on one level of the organisation, obviously it can have a knock-on effect to the next. So it's not just about increasing the pay on one level. So of course the implications then go through the structure. So, you know, essentially Freedom have had a bit of a challenge in recent times around staff retention in some of the key posts, you know, such as swimming teachers, some of the fitness class staff, some of the fitness instructors based in the gym. So it has been a challenge, not just within the local Freedom Leisure sites, but as a national challenge in terms of staff retention. So just looking at the proposal in front of us this evening, so with inflation currently standing at 1.7% CPI back in September, Freedom are proposing an average increase across the various categories of the activities that they offer of 4.4%. So we've included within the report there just an overview in the table of the various categories of activities, both supervised and unsupervised, that Freedom Leisure provide across the sites. And you can see that there's various degrees of increases involved there. And I'll kind of come back a little on that a bit further along the kind of presentation. We've gone through a local benchmarking exercise from the point of view of looking at the swimming activities. And you can see from the table in section 3.3 that despite being the most recent building to be built out of all the local facilities, that Freedom is still comparable with local other facilities around kind of Bromsgrove, Redditch, Droitwich, Pershore, Evesham, who are kind of operated by one particular operator in that respect. So I think what we're looking at tonight isn't out of sync with the facilities that you can visit locally. One of the conversations that Freedom Leisure have as part of this process is to very much kind of talk to the user groups as well. So they've got a very good relationship with Worcester Swimming Club, who obviously are a very significant user of the facilities at Purdeswell Leisure Centre. And again, each year they go through a process of getting around the table with the treasurer, having those conversations and agreeing what that proposal looks like. So we always make sure that as part of this process that those conversations have been agreed in advance. In terms of on-site partnerships, they have a very good partnership with the Heart of Worcestershire College, who have an interest in the facilities that were built as phase 2 of the building back in 2017. So they have daytime access to classroom spaces so that it enables them to deliver their theoretical side of what they do within their curriculum as well as the physical side. And as part of that, Freedom Leisure, in partnership with the college, do offer a discounted membership to all of their students. So the students essentially only have to pay 50% of the cost of an annual membership. So it's really kind of encouraging them to stay active, and the uptake on that is really positive. One of the things I wanted to emphasise as part of the discussion tonight is that probably the largest increase that we'll see within this proposal relates to the fitness classes, and in particular to a licence that Freedom purchase in order to operate the Les Mills fitness class programmes. Now, the programme of activities that they run are extremely popular within the leisure centres. We've found that in some examples, other facilities locally have taken the decision not to continue with offering those programmes and have taken some of those classes back in-house. But within the Worcester contract, they are really, really popular. And every time the Les Mills programme launches a new class and we do a launch event, there's inevitably 100 plus people taking part in that programme, and therefore it has to be hosted within the main sports hall just because of the capacity. From the point of view of tennis, we're looking at the moment this year at an increase of 2.9% in terms of the pay and play tennis costs. The costs in recent times have been kept to a minimal. Again, it's important, I think, to emphasise here that in terms of the annual pass, the increase of 2.1%, that enables families to access the courts for up to 4 hours per week within that membership. So once they've paid their annual fee, they can play up to 4 hours a week with each member of the family. And essentially, if they were to utilise those hours of 4 hours each week, that would work out at about 35 pence per visit. So from an access point of view, you know, there's ways there that costs can be prevented from being a barrier. Again, we've been delighted year on year since the launch of the tennis courts to be able to work in partnership with Freedom Leisure to offer an enhancement to their contractual obligations around free tennis. So essentially, Freedom provide to 15 hours of free tennis per week. And what the City Council has chosen to do each summer to date is to support that by providing what has been so far this year 15 days of free tennis, which the Chair was heavily involved in and has been the most successful period that we've operated to date, with over 1,000 people taking part during that period, which came post-Wimbledon. So that's a really positive story. So in terms of the preferred option that we're looking at this evening, that is that we move forward with the range of increases that we looked at in the earlier table, because that allows Freedom the flexibility to identify where the demand is and where they feel they can and can't or don't wish to put their prices up. So, you know, although we've considered other options, such as just putting in a standard increase across the board, that may result in some activities then no longer being viable, and then we would have to take them out of the programme. So I think the approach in terms of the preferred option that's been taken just gives them, as the operator, the flexibility that they need to make sure that they can get the activities programmed into those slots where the demand is at its highest. And the other option that wasn't really considered is that we don't apply any increase, and that kind of comes into section 6.1 of the report, which I just identifies that you know, the fees and charges increases year on year play a role in enabling Freedom Leisure as the operator to meet their contractual obligations through the payment of the quarterly management fee. So just to sum up, in terms of the recommendation, we're looking that for the committee to note the content of the report, and in particular the proposed fees and charges for 2025, which can be seen in more detail at Appendix 1. We are recommending that the fees and charges at Appendix 1 go to the Policy and Resources Committee later on this month for approval, and following that, they go to policies, once they've been to Policy and Resources, that they also then go on to Council in December for full and final approval. So, thank you, Chair.
Yeah, thank you, Alan. I mean, it is worth noting, just in terms of the tennis, we did, councillors Udall and Lamb did raise that prior, in terms of feedback from the general public in that, and some other councillors as well, in terms of accessibility. So it was a listening exercise from us, and obviously consulting with that, so resulting in a successful offer that we've had in this report. I'll open it. I'll reserve my comments till the end. I'll open it up to the floor now in terms of the fees and charges. So I'll take questions from the floor. Councillor Mace.
Yeah, thank you. So I had one suggestion from a resident I wanted to pass on, and one question. One was we need to make a better, give residents better notice of our carbon saving projects. So it would be interesting if when this leisure centre has the solar panels installed on the roof, if we could have some information shown on the screens that are on site, like how much is being generated or what's the current carbon footprint of the swimming pool, so that people are better educated. And even if a pass could be offered for like low carbon swimming, so if you're coming in like during the summer when there's lots of sun shining on the leisure centre, that you can come in for a cheaper swim during low carbon times. And then the question I had was, so swim school membership's going up by 10.5%. I know there was a little bit of noise on social media last month about swim class sizes being increased at Purge as well. I just wondered if you could confirm, have swim size classes been enlarged, and what's the main reason for raising the fees by 10.5% if that's the case? Thank you.
Yep, thanks for the questions. I'll answer the first one around energy and better publication, really, of the good work that we are doing. I absolutely fully accept improvements could be made. We do have an environmental notice board in our centres across the Worcester contract, but we've got access to social media, an app, a website, and we could absolutely do more, and that's noted. In terms of the swimming lessons, the class capacities we've reviewed across the whole organisation to align ourselves to the guidance from Swim England, who are the national organisation that look after swimming across the country. So yes, we have reviewed class capacities to enable more opportunity for people to be able to book on, but that's been done in line with the guidance through Swim England. In terms of the fees and charges increases, increase in fees and charges is the last thing that we want to have to do. But in the current economic climate, with the cost pressures that we've had, and as Alan has mentioned, year to date, we've seen our costs rise by 9%, yet our income has only increased by 4%, which is broadly in line with the fees and charges uplift that we did last year. So unfortunately, we do have to increase our fees and charges to ensure that we're viable. And just to sort of point out, last year, the need for council support was £189,000. Had it not been for that, we'd have seen a deficit of 190. So we've made a lot of sacrifices to enable us to get to that break-even position through staff restructures, a reduction in operating hours at Nunnery Wood. We're really trying to navigate through some challenging times. Obviously, have the pandemic, utility crisis, and I'm sure there was a couple of others as well that we've been dealing with, Alan. What I would say as well with regards to the swimming lessons, whilst there is an increase there, children get free swimming, unlimited swimming at all public sessions, and that's one thing that we've stuck to within the contract. And there are other partnerships out there that have completely removed that. So I did want to highlight that. And we've also just implemented, or recently, some loyalty rewards for swim school members. So lots of discounts on other programs throughout the facility, 10% discounts on holiday camps, reduced sort of discounts on cafe, and many other things. But for me, again, we've invested heavily in our workforce, £10,000 spent on swim teacher training in the last financial year. We're up to 7 year to date. So raising fees and charges is the last thing that we want to do, but we simply need to do that.
Thank you. Do you have any other speakers? No? Okay, I'm just going to sum up. We have, and Alan, you, and obviously a really, really experienced officer in terms of obviously knowing the landscape, having worked through our pleasure centres forever since I was a kid, and using Nunnery Wood. I've known Alan in terms of that, and obviously you've gone through it with a fine-tooth comb in terms of justification. We do have to have a look at, obviously, in terms of what are the service level agreement that we've got and the management fee that we expect from you in terms of that, and the offer that, and obviously, and moving on from the report that you've highlighted earlier in terms of your management and the number of services that you've now increased as a result of that, and that you're part of that, and the performance that you're obviously providing. I did, rather foolishly, made a flippant comment to Alan in saying that actually Freedom Leisure are doing average or just above, and you put me right in terms of that, actually, because we've got really high level of expectation within this city of what we do. We've got a really good level of counsellor engagement and scrutiny that actually asks the right questions and makes sure our operators and people that provide services to us are on the ball. And we really haven't been outside to other leisure operators to understand what level of offer is there. So we take our officers' words in in high regard in terms of actually that Freedom Leisure are a really good operator and a solid operator, and translating our vision from a city perspective into what we want in our communities. So I mean, in terms of and in line with the costs that you're having to face in terms of the increases that you have to implement, then I recommend these charges, these fees and charges to go up in line with what we're asking. So I ask members to approve 1.1, 1.2 and 1.3 in this. All those in favour? Thank you, that's all agreed. So next agenda item is agenda item 7, Quarter 2 Performance Report, and it's Lloyd, over to you.
Thank you, Chair. Chair, just in terms of the key projects and actions, members will see there are 3 green on track. The capital project relating to PERD as well, 3G pitch has been completed. There are 2 ambers. One relates to the community strategy, and we've taken the decision to pause that and await the outcome of the city plan consultation to see what residents are saying, and to look at that alongside the development of a new city plan. And the other one in amber is the private sector housing strategy. Unfortunately, there's a delay to that as well. We just need to do some validation of data that's been collected by the contractor before we bring that back to you in January. In terms of the key performance indicators, again, pleasing to note that most are green, so above the line. A number of red. I'll just pick up on those. The percentage of ASB inquiries resolved within 1 month. We are starting to see an increase in the complexity of cases relating to ASB. So they are taking longer, and that's what's pushed us into the red. But I think the important thing to note there is people aren't being left stranded. The team are continuing to work with them and continuing to check in with them. So that contact is there. The number of affordable housing completions, that's an annual performance indicator. So it's red based on last year's number. And again, this committee receive multiple reports throughout the year on our housing enabling work, and there's one this evening that James will present. And the other one is tenants in parks, the paid for provision. And again, I think you've heard enough from Freedom this evening about their plans and their sort of willingness to improve that. But again, just to note that even though it is red, over 2,500 people paid to use our courts during quarter 2. So happy to stop there, Chair. Happy to take any questions if we can.
Yeah, thank you, Lloyd. I'll open it up to the floor. Any questions? Councillor Amos.
Yeah, thank you, Chair. My question is on, excuse me, page 81, households on the waiting list. Obviously, the number is just now touching 4,000. Somebody spoke to me a little while ago about being on the housing waiting list, and the reality is that most people are not going to get any offer at all. So they asked for my advice for what it was worth, and I said, well, you need to look into the private sector, obviously renting in the private sector, but of course, pursuant to my earlier point, Chair, the private rented sector is under some pressure in Worcester because the Home Office is coming along with a fat wallet, pushing up prices and taking away availability. So seriously, what advice would officers give to this couple who would want to go into the private sector as the last resort, their only resort, frankly, in a child on the way? So I suggest the private rented sector, but of course prices are being pushed up. Supply is not increasing appreciably at all. We've got this massive new demand being forced upon us. So what is the answer? Because, this is a real problem.
Lloyd, do you want to?
I think there are multiple issues that put pressure on the private rented sector. Chair, affordability is an issue in Worcester. Number one, we're a university city, so there's pressure on the private rented sector there. And as Councillor Amos rightly points out, we've got a shortage of social housing. I think the only advice I think we would provide, and I'd look to colleagues within the housing team, is we've got multiple agents, multiple landlords, and to try and scour as best they can to find a private rented property But apart from that, I might turn or defer to colleagues who probably know better than me.
It is difficult, and I think I've made the point publicly, Councillor Amos, in terms of if you were on a tier two of silver, is it a tier two? But if you were on a band two, then realistically you're probably never going to get housing onto the housing ladder in Worcester, and that's the reality. I'm not hiding that fact. I've made that known fact that probably is extremely difficult. We're fighting for every unit of space that is available to retain it so we can make it useful for people that are on the waiting list. And we're pushing back hard on any government requirements or pushback in terms of that. We're having that fight, we're having that discussion, we're making our case for Worcester absolutely known in terms of that. So, you know, we're not resting on our laurels, we're not hiding behind any false facade there. We're fighting the case for Worcester, and of course it's obviously national legislation, but you've got to take into consideration that whatever is happening on a national level is trying to be done on a fair and equitable basis across the country. You know, it's not done willy-nilly. It has some thought behind it, and there's a strategy behind it that the government, whether it's the current government or the previous government, there is some thought behind that. So rest assured, Alan, I appreciate your point. It is extremely difficult to get on the housing register here, and this is something that we're determined here in Worcester to try to do something about in terms of that. And one of my missions at the start of my term this year was to make sure, or try to get, if it's within my possibility, the first council-owned or operated housing within that, and I'm still pursuing that. So we start that process of that mindset of being able to try to tackle these issues. And a later report that's coming on here and in there will highlight obviously the cost that we pay in terms of temporary accommodation and in terms of trying to reduce that. So I have got a plan. I'm trying to execute that plan. I need the vision and help and support of everybody around here in order to be able to do that. It's high on the priority, and I completely understand your concerns. Councillor Tissera.
Thank you, Chair. I'd just like to ask a question about the ASB inquiries resolution. And I think it was stated that they're more complex, they're taking more effort to resolve. Are they already highlighted for linking up in the way that Freedom Leisure are going out to communities? I mean, is that any part of something that might help, not as a quick fix, but as part of a longer term view on trying to have antisocial behaviours, maybe from youths, possibly diverted and re-energised into something more useful?
Yeah.
Tom, do you want to take that?
Thank you, Chair. Yeah, I mean, we have youth intervention workers that are operating out in the community. They'll identify hotspot areas which are shared either by partners or identify themselves. So very much we do that proactive work. I think this PI, particularly this quarter, there's been a number of cases which have required multi-agency involvement to resolve, and they just take time sometimes to resolve fully, but we won't close the case until a resolution's been sought. But on your point, yes, we do proactively go out into communities.
Just meant linking up with the Freedom Leisure activity side that they mentioned about, anyway, I just wondered if those things were hooked up or should be.
Yes, and a lot of that work is coordinated through the Youth Collaborative, so not just the City Council, not just Freedom Leisure, but other partners are engaged in that activity, so yeah, it is connected.
Thank you. You've got Councillor Mason, then Councillor Lawrence.
Thank you. I just wanted to commend officers again for another quarter with no families in B&Bs for over 6 weeks. It's great to see that remaining at 0, so long may it continue. Thank you.
Thank you, Councillor Mace. Appreciate that. I'll pass that on to officers. Councillor Lawrenson.
Thank you, Chair. Questions about the review of private sector housing strategy. And so we've commissioned an organisation called Opinion Research Services to complete a data analysis of the stock condition survey. I just wondered what the reason was for the delay. We've got a really busy agenda, so we're probably actually quite grateful that there is a delay. But having said that, there must be a reason for it. Are they they're short-staffed, or what's going on?
There is absolutely a reason for it, and part of it is they didn't tell us, they didn't do what we'd asked them to do.
Thank you, Chair. Yeah, I mean, there's a range of different reasons. Some of it was essentially it's been delays in getting the data. So part of the process has been doing some visits at individuals' houses, which requires engagement. So they send out letters to try and encourage people to participate. So there's been challenges in undertaking those visits, which created delays. And then the sort of desktop data analysis needs to be cross-referenced against the data that was obtained on the ground. We were hoping that that would have all been concluded to bring the private sector housing strategy to this meeting. Unfortunately, that's been delayed. There is scheduled to be a briefing from the provider imminently. I think the date might have actually been set later this month. So it's almost concluded now, and we'll be able to bring the private sector housing strategy back in January, which will be informed by the stock condition survey.
Yes, sure.
Yeah, thank you for that assurance. I'm looking forward to the presentation. I think it's going to reignite the debate that Councillor Amos clearly wants to have, and which I agree with him. We should have the debate about transparency, about housing, about how influential we are as councillors. So I look forward to that presentation to understand the condition of private sector housing in Worcester, and I do think it's going to reignite the debate that is going to happen at some point about how powerful this council really is, and how accountable we are to the people of Worcester. So brace yourselves, everyone, for January. That's what I would say.
Jeez, a bit rumble in the courtroom. What Mr. Nelson?
Won't be me, be him.
Thank you. Do we have any more speakers on this item? No, can we take that as noted then, please? Yeah. All those in favour? Yeah. Yeah. Thank you. Thank you. We've got agenda item 8, which is setting of the budget for 25-26. Sel, over to, sorry.
Thank you, Chair. So this is now the yes.
Thank you.
Kathy Davis. So this is now the established approach to the early stages of budget setting for the council, and committee is receiving a report that follows a similar structure and methodology to previous years. So hopefully councillors will be familiar with this. The rationale at this point is not to have a debate, but to simply present you with the information on the finances relating to this committee. So you can see the areas that you may want to change going forward. We'll come back in January with a proposed budget, and members may have a view then of what they might want to change, what would they expect to change, what they'd like to see changed. That's all bearing in mind that we currently have £1 million gap in the 25-26 revenue budget. So the information presented here in Appendix 1 it shows the transition of the revenue budget from 22-23 through to 24-25 in relation to communities, covering both income and expenditure. If members want to have more detail on any of this information, please contact me or the Interim Director of Finance and Resources for further discussion. I'm also presenting at Appendix 2 is Q2 year-end forecast for capital programme, and also at Appendix 3 you've got the full capital programme, the budget as set in February 2024. And then finally, at Appendix 4, you have the city plan project budget to view. For now, this is more about providing information to you. And as I said, we'll come back in January with more details. So if you have any questions in the meantime, please contact me or Sal, and we can respond to you and provide further detail. Thank you.
Thank you, Catherine. That's fine. I'll open it up to the floor. Do we have any questions? Councillor Amos?
Thank you, Chair. Could I ask a question on Appendix 4? It's just the one item. PSPO enforcement officers, 60,000, take away 60,000, no further spend is planned. We have a number of PSPOs. As you know, I strongly objected to the removal of the cycling one. But we have other PSPOs still in existence, as I understand it. Are we saying that we're not going to enforce any of them? Because there is a phrase which I was too polite to say at committee, but if we've got to enforce PSPOs and we're not enforcing them, what is the point of them? Appendix 4. Yeah, it's 2/3 of the way down. It says PSPO enforcement officers, 60,000 included, 60,000 is removed, and it says no further spend planned. So it looks as though whatever PSPOs we've got, we're not enforcing them, unless I've misunderstood it.
Thank you, Councillor Amos. So just for clarification, is it a budget item you're talking about or a PSPO?
Yeah.
Just to clarify...
Well, am I ahead of ourselves, or have we gone too fast?
I can just answer that quickly. That money has been spent already.
Yes, yes. I appreciate that, Chair, but my concern, everybody's talking about budget, the items on the budget, then obviously the money has to be spent. I appreciate that, but it says no further spend planned. So as I understand it, we're saying, well, we've got some PSPOs, we're not going to enforce them because we've got no money to enforce them with. That seems a bit of a bizarre situation.
Okay, thank you. Lloyd?
Thank you, Chair. So our PSPOs are enforced through our civil enforcement team, our civil enforcement officers. They are now almost practically all multi-skilled, so they don't just deal with parking, they will deal with environmental crime and PSPO issues as well.
Sorry, Chair. I think Mr. Griffiths spoke very quickly on that. Can I just clarify what he said? They've got PSPOs in place. Obviously, the whole point of them is they must be enforceable by whatever the officers are called. But it says here, no further spend is planned on PSPO enforcement officers. Is it because they're called something else? So there is enforcement, and it's a different budget that we should be looking at.
So the 60,000, let me know if I'm not speaking slowly enough, Councillor Amos. The £60,000 that's referred to in the document, that was for additional resource that was dropped in for a temporary period when we introduced the 3 PSPOs 4 or 5 years ago, whenever it was. We're not planning to introduce any additional resource from where we are at the moment. Our civil enforcement team are fully staffed. They are multi-skilled, and it is that team that will enforce the PSPO legislation.
Thank you. That is very clear, Chair. So in that case, it is the conclusion then that we have enough other officers to enforce existing PSPOs, regardless of the 60,000 which is now no longer available.
That's correct, Chair.
So that's the clarification. Thank you. Councillor Mace?
Thank you, Chair. Yeah, my question was on the private sector housing line in the community's budget. So in 22-23, the annual budget we were showing a loss of £22,000, but we actually ended up with a surplus of 41,000. I was basically just wondering why, what happened in that year to bring that about. And we've also got a shortage in 24-25 of £110,000. So I was wondering what's changed over the years for that budget. It's on page, it's labelled page 87, but it's actually page 93 of the pack. It's the penultimate line.
Yes, I can answer that for you, Councillor Mace. The difference between the 2023 budget and 2023 actual, we had a surplus of HMO licensing income. So we had a better position at the end of the year than we budgeted. And then finally, the spike up to 110,000 in 24-25 is because we added housing prevention grant into our base budget. So we took on additional employees funded by that grant and updated that budget to reflect that.
Thank you very much.
Thank you. Do we have any more questions? No? So, recommendation is to note on 1.1 and 1.2. All those in favour? Agreed. Thank you. Thank you, Catherine. Appreciate that. If members would like, do you want to take a 5-minute break now? 5-10 minutes? We'll be back at 10 to. Thank you all. We ready to go, Julian? Good. Thank you. So agenda item number 9 is the review of the Worcester City Council Additional Houses and Multiple Application HMO licensing scheme, and we have Ismini to present the report. Thank you.
Thank you, Chair. So just going into the background of what a HMO is, it's defined in the Housing Act 2004 as 3 or more people where 2 or more households share basic amenities such as a toilet, bathroom or kitchen facility. The Housing Act also legislatively defines a section 257, which is a building or part of a building which has been converted into and consists of self-contained flats, where the building work undertaken in connection with the conversion does not comply with 1991 building regulations, and where less than 2/3 of the self-contained flats are only occupied. There also needs to be 2 occupiers of the whole building. Property standards in HMOs can often be lower than other private rented properties due to poor conversions of old properties, more than one household living independently, and a regular turnover of occupiers, and in some occasions, poor management by the landlords. However, HMOs are a really important part of the private rented. They're a popular form of affordable accommodation, particularly in areas like Worcester and university cities. The main aim of licensing is to ensure that high-risk properties in the private rented market meet legal standards and are properly managed to provide greater protection for the health, safety and the welfare of the occupiers in these properties. There is 2 schemes. There's a mandatory licensing scheme, which captures the proportion of HMOs. These are properties that have 5 or more tenants. And then there's the additional licensing scheme, which Worcester has had running since 2015. And that captures those HMO properties which have less tenants and are Section 257 HMOs. The 2015 scheme was approved and that lasted 5 years. In March 2020, this committee approved a further additional licensing scheme which covered 5 wards. And in March 2023, a second scheme was approved to cover the remaining wards in the council, remaining council wards within the city. The nature of these schemes was that both schemes are set to expire in August 2025. As part of the designation process for any new scheme, the previous and current schemes need to be reviewed, and this includes a 6-week public consultation for those who may be affected. An evidence review is also required to be undertaken to show that the proposed additional licence scheme in the area demonstrates that there's a significant proportion of HMOs which are being managed sufficiently ineffectively to give rise or likely to give rise to one or more particular problems, either for those occupying the HMO or member of the public. The use of an additional licensing scheme is consistent with a housing strategy, coordination of the authorities' approach on homelessness, empty properties and antisocial behaviour. Where it's considered that additional licensing is the most appropriate course of action, a designation is then signed. The timeline for this scheme, if the consultation is approved, is the consultation will open next week. The consultation period will close 6th of January 2025, and the outcomes of the consultation will be presented back to Communities Committee in January to outline the findings and recommendations. If the recommendation of that committee is to approve the designated 5-year additional licensing scheme, the designation will be made in June 2025, and there's a statutory 3-month time period between the designation and the scheme start, which is proposed should it be approved and be the most appropriate course of action to start on the 1st of September when the previous schemes end. So as I mentioned earlier, part of this process was to evaluate the current schemes, and the full evaluation is in Appendix 1. And just pulling through the key highlights were that there's been an increase in properties converting into HMOs without appropriate planning permission, and this is over the 5 years that the previous schemes have been in situ. There's been an increase in housing-related complaints to Worcester's University Students' Union. However, this might also be linked to the team really promoting what they can do to assist the students being more aware of their rights and reporting where standards might fall short. The number of complaints to Worcestershire Regulated Services about HMOs related nuisance has remained relatively stable. 40% of additional licensed HMOs inspected required inclusion of additional licence conditions due to non-compliance. And we also found that 1% of all licences issued were breached in some way due to non-compliance. A total of 9 properties, which between them breached 21 licence conditions, resulted in 3 civil penalties being issued on HMO landlords. The number of unlicensed HMOs investigated every year has reduced, and this could be due to the effects of the private sector housing team in identifying and pursuing the landlords of those properties which weren't licensed in the current schemes. That's the section on the consultation part of additional licensing scheme. The next part of the report goes on to mandatory licensing and additional licensing fee structure. So one of the other recommendations is proposing to introduce a 2-part payment structure from the 1st of April for all HMOs. So this is mandatory and additional. It's important that we point out at this point that the overall cost of the licence is not proposed to increase, it's just simply a mechanism of payment that's proposed to be changed. This would result in a Part A payment, which would be non-refundable and paid at the submission of the licence application, and a Part B payment, which is payable through the council's website once the licence application has been processed, the property inspection completed, and the licence is ready to issue. Having benchmarked the council's HMO licence fees regionally, most councils have introduced a 2-part payment system. Furthermore, benchmarking indicates a preference to hold the licence fee at its current charge and not paying uplift for 25-26. This would be reviewed at budget setting in 26-27 and can be reviewed annually through fees and charges. We're also looking to propose that Section 257 HMOs, so these are the properties which are converted into self-contained flats, which do not meet 91 building regs, are included in the consultation part of the additional licensing scheme. These properties are more likely to have been converted poorly, resulting in fire separation between flats, poor fire detection, poor noise insulation and inadequate heating and cooking facilities. They have been included in previous schemes to ensure that all HMOs are inspected and that all HMO tenants are living in safe conditions and well-managed properties. With Section 257s, there are officer implications, as some landlords have had these properties for a very long time and haven't appreciated that these are HMOs and that they need a licence, because they're less of the traditional HMO shared housing. These tenants are in their own self-contained unit. And it's also very complicated when different flats in the building are owned by different people to establish who the person in control is. Just to highlight, Section 257s have been included in the previous schemes, and the officers have been proactive in trying to ensure that they're complying with the licensing schemes. So the preferred options are to meet the recommendations, which if I just go through them. So the first recommendation is to note the contents of the report and particular both additional licensing HMOs are due to expire in August 2025. To note that additional licensing evaluation exercise has been undertaken and the evaluation report has been included as Appendix 1. That the committee approves a public consultation exercise being undertaken on a proposal to operate a single citywide additional licensing scheme from September 2025 to include Section 257's HMOs. To approve a new fee structure for both mandatory HMO licensing and additional HMO licensing as set out in Section 4 of the report, noting that this will not result in an increase in overall fee price, but a change of structure. And to note that a report will be presented to this committee in January 2025, which will include the consultation results and for that decision on additional licensing. Thank you, Chair.
Thank you, Smithy. I'll open it up to the floor, please. Questions? Councillor Mace, Councillor Lawrenson.
Yeah, thank you very much for the report, and I think the report very well demonstrates the importance of a licensing scheme, but with 40% of properties having conditions applied to them when they're inspected. I had a small number of questions, and then I wanted to make a more wide-ranging comment, which was, when were the question is, when were the fees last reviewed, and what makes splitting the fee best practice? I understand that other authorities do that. I just wanted to understand why they do it.
Okay, so in answer to the first question, the fees are reviewed annually as part of the fees and charges process, which ends up going through P&R. With regards to the best practice, it's following legal recommendations from courts, and they've advised the best practice is to have this two-part payment system, which most councils seem to be moving towards.
Okay, thank you. So I think, I definitely support the idea of having a additional licence scheme in place, and we absolutely do need that. My big problem is with the section in 1.4 about noting that it will not result in an increase in overall fee price. And I think, as we mentioned earlier, there is a over £1 million budget gap to be closed, and as I mentioned earlier, the 24-25 budget for private sector expenditure shows 110,000 deficit. And in a time when we're asking residents to pay more for less, because that is the nature of our funding, we can't increase council tax enough and we have to cut back on services. I can't support anything that doesn't ask HMO landlords to contribute more as well, because I can't imagine they won't be increasing the rent of their residents within this year. And so to support this, I would need to see a default increase in the fees of at least CPI plus 1%, which would currently be, I think, 3.6%. That's what I would need to be able to support this measure.
Yeah, thank you, Chair. I think that a couple of points have been raised by Ismani in terms of where we are at the moment. So fees and charges and sort of setting them wasn't the intention of this evening's report. The opportunity to do that will come as part of budget setting. But I suppose the two or three points that officers have considered in terms of our thinking is number one, the benchmarking that's been carried out. Ismani made reference. I think we're the second most expensive fee, just behind Bristol. So to increase it again will put the council in quite an enviable position, and certainly have a spotlight shown on us. I think the other thing is that given the change that we're going to apply to landlords subject to approval this evening in terms of splitting the fee up, we were just slightly concerned about imposing a bit more change on top of that. And I think thirdly, as I mentioned earlier, because affordability is an issue within Worcester, and because we do have a lack of social housing, we want to try and be encouraging landlords as much as possible to continue to operate within the private rented sector. So I'm just giving a little bit of thinking about where officers are coming from in terms of our thinking. But I think the important thing is that this evening's paper it isn't about setting a fee for the scheme.
Thank you. And I suppose from having had this discussion prior to this meeting in terms of that, and just to kind of follow up on that, not only obviously the benchmarking, but there is probably a real sense that some of those charges are going to be straightly passed on to tenants, because effectively that's what the market is. Any charges that go up, generally landlords tend to pass it on to kind of the tenants, so it's a kind of a vicious circle. What we're suppose the bigger argument should be in terms of rent control, and something that other people have kind of mentioned from a national level of a set number of limits. So any charges that we do then increase don't get passed on. So it is a danger of that. And of course, the other point that's mentioned here is that it isn't a fixed thing for a number of years. We review it on an annual basis, and we'll have that opportunity to do that. So it's imposing. And finally, I suppose, in terms of obviously that relationship with landlords, the biggest thing that we've found or since I've been in this role is the relationship building with them and working with them to improve housing conditions and to keep them on board so they comply and improve their housing. So ultimately that's our aim here. Our aim through this policy is to improve housing stock, not to take you see them as a cash cow, if you see what I'm saying. Although I take your point in terms of inflationary increases, but we're already one of the highest in there, hence why I don't think I can support that recommendation. Councillor Lawrence?
Thank you, Chair. Just want to make a couple of comments and end with a question. So I think the rationale, the reason for this proposal is summed up quite nicely in page 8.3a. Without additional licensing, landlords could operate smaller HMO, that's house of multiple occupancy properties, and potentially overcrowd them with increased risk from fire, spread of illness, and reduced quality of life. So this is why I believe we should have this additional licensing, because this is about people living happier lives. It's as important as that. That's comment number one. Comment number two, also within 8.3a, a few things grind my gears more than hearing about rogue landlords. And I'm quoting here, taking advantage of tenants' knowledge or lack of knowledge and limited options to house people in substandard accommodation and evict tenants without following due process. So I hope that when eventually this additional licensing comes in, because it will, that it deters people from being or remaining rogue landlords, because it is about quality of life, and I have been, as you can probably tell, on the receiving end of a rogue landlord. It's not pleasant. That's comment number two. Question is about the consultation. Now, given that students are perhaps disproportionately affected by rogue landlords, will we, as a council, be putting in an extra resource to facilitate the consultation with students who perhaps notoriously might need a gentle nudge to get things done? So will we be having officer presence on campus? Will we be advertising even more so within campus to ensure that we get the feedback to make the consultation as meaningful as possible?
Yeah, thank you, Councillor Lawrenson. And first 2 points taken, absolutely beautifully put. Actually, that is the point and the purpose of this policy, and it is the determination on behalf of the Labour Group through 3 years ago to make sure that this happened, this citywide scheme happened. And we know that the previous scheme was manufactured in such a way that it excluded certain areas, and we don't need to go into the details about that, but that's how we saw it in terms of that. This is absolutely about the quality of life, and I'm glad to say over the last couple of years we've seen that improvement. Ms. Meany, do you want to pick up on that last point?
Yeah, certainly. We've got links with the Students' Union at Worcester University, and I'll be seeking their advice on how they want the survey to be best put out to students, because we do need to hear their voice as well. If they would like us to attend the university on particular days to try and hear students' voices, we'll go and do that. That's not a problem.
Thank you, Councillor Lawrence. Councillor De Sarah?
Thank you, Chair. So yes, this scheme's about protecting people, and very good in that regard. But there is one element of it that still is frustrating, and it's nothing we can do about it right now, as far as I know. But if an HMO is unlicensed, unregistered in any way, but suspected, it's very difficult to get an inspection without the resident themselves asking for it from the council. So I'm not proposing there are going to be any solutions to this tonight, but it is, for me, a big frustration, especially in certain areas of my ward, where I'm fairly sure that many people are living in one house, and I don't think they're on your radar, and I'm not sure that I'm going to be able to get them there.
Can I come in on that one?
Meany, do you want to clarify that?
Just to clarify, with HMOs, we have a lot more paths of entry with them. So if you suspect a HMO, or if any a councillor suspects a HMO, let the private sector housing team know, and we can investigate it and attend the property. When it's a non-HMO, that's where it's slightly more difficult with the complaint part of inspecting the property without the tenant's permissions, whereas HMOs, that's like easier.
Sorry, I didn't quite make myself completely clear. Yes, that's all understood, but a lot of the people involved are too scared about consequences, being evicted. And I know that there is Section 21 type thing coming through, but nevertheless, I'm just saying that your progress has been great. There's still a lot more to do, and it's not an easy nut to crack.
I think, yeah, thank you, Councillor Desera, and really valid point in terms of that. I mean, the question I think we should be asking ourselves is that in this policy, should we not narrow it down, but focus our attention on the HMO scheme and not do all of it? Because obviously this is resource intensive work. We've seen in the report that there is issues around inspecting all of our properties and on time, and come to that would I mean, this is a question to the committee, it's not a decision for me, is whether we should concentrate on one aspect of it first before moving on to the other. That is a valid question in terms of if we wanted the best result in terms of that. So resources can be pushed to what members think is the best appropriate use of resources. I'll take Councillor Holmes and then Councillor Amos.
Thank you, Chair. I'm very pleased to see this scheme coming in, because I do think we have got a problem with some of our HMOs, particularly the ones described as S257. I had one household where three of five flats complained to me, all separately, not knowing, on the place had been subject to flooding, and one of the things that bothered me most when I visited the place was the mould. And when we mentioned mould and the moulding, the residents actually had to complain. Now, will that be included in the scheme when you're going and looking at will we be looking at this, the mould conditions, and therefore that will get around residents having to complain when they might be fearful of doing so?
So if it's a licensed HMO and we're inspecting it for a licensing purpose, the landlord has to meet a set of conditions which are available on the website, which details exactly what standards we expect for HMOs. When we're going into the property, we'll look at it as a holistic property. We'll see what the issues are, and if anything needs remedying, we'll be able to tackle it from that point of view.
Thank you.
Thank you, Councillor Amos.
Yeah, thank you, Chair. Yeah, I'm very happy with the structure and the additional licensing scheme. It was just really a comment on the exchange between Councillor Mason and yourself about the fees for HMO. I don't mind, frankly, whether we're second in the league or top of the league. Frankly, if we're charging more than anybody else, that wouldn't bother me in the slightest. Because my question is really about what is the actual cost? I do find it extraordinary that if we're being told the cost of the scheme hasn't gone up when everything else seems to be going up. It's mainly officer time, so I can't see how the cost of the scheme hasn't increased, and therefore we should be increasing fees accordingly. Otherwise, we are presumably subsidising or cross-subsidising these fees, and I don't see why we should be doing that. It just doesn't make sense, Chair, that we don't need an increase. That's what I'm saying. So could somebody clarify that?
No, thanks for the question. And I think part of the understanding from my perspective from officers was that actually, in terms of administering the cost of administering this, the increase can't be justified. Is that correct, Councillor Lloyd?
Yeah, totally understand Councillor Amos's point, and the fee should be set on a cost recovery basis. So I think one of the things that we will need to do before we get to fee and charge setting in February is to undertake that exercise and explore what the true costs are, and then compare that against our fee, and then we'll be in a better position to be able to explain that through to you.
So what is the officer saying, Chair, that if there is an increase in our costs, we will increase the fee accordingly? Right. Thank you.
Thank you. Hope that clarifies. Is there any other further questions on this? Or comments? No? I mean, yeah, Councillor Mace.
So I just wanted to say that addresses my main concern, which is that we weren't just going to hold the fee where we were, whatever. If we're going to increase it in terms of cost, then I'm happy with that.
Yeah, no, absolutely. If it's costing us, then we would absolutely increase it. Why wouldn't we, in terms of that, 100%? We would not make a loss on something that we're putting a full service into. I mean, just in terms of general policy, absolutely, this is a culmination of the two policies, a combination of those two policies that we introduced a number of years. Absolutely makes sense for us to continue it. We, as a city, have brought city housing standards up, and will continue to drive those standards up. Taking the point of Councillor Lawrence in terms of rogue landlords, there are rogue landlords out there, and local landlords that people have been subjected to personally, and rogue landlords that continue to operate the way they do, and the tenants in them are afraid to speak up, you know, and that's what we're trying to get through to, and for that mechanism to become easier, for them to have the confidence to be able to talk to us and to talk to officers and local members to understand those issues, so we can go out and absolutely enforce. This policy enables our officer team and corps to be able to enforce and give them the teeth and the power needed to be able to drive that standards up. And you know, quite frankly, in a first world country, to have one of the poorest housing standards in Europe on that is quite frankly unacceptable, and we should all be ashamed that it actually exists in our city. And I'm collectively happy that we've got a bunch of councillors that are committed to this and see the absolute benefit of this. So I've got no hesitation in asking you to approve this and to take it to the next stage in terms of consultation. And finally, obviously, thank the officers for all their extreme hard work and what they've been going to do this. They've been constant under pressure in terms of obviously trying to deliver on this and dealing with all of our queries out in the wards to make sure you know, all the difficult cases are addressed. So if I take them on block from 1.1 to 1.5, all those in favour? Agreed, that's unanimous. Thank you, Smithy. Agenda item 10, we have the Worcester City Housing Enabling Strategy 6-month update. James, do you want to come up? Thank you. It's James Beale. Yeah.
Thank you, Chair. Shall I start? This is the third progress update report for the Housing Enabling Strategy. It's the second update report since the enabling team has been in place, which is me and my colleague Daniel. As you know, the delivery plan to the Housing Enabling Strategy sets out 8 goals, which you can see in table 1 of the report. And the appendix includes the actions and targets which are detailed in tabular form and appended to the report, obviously. We've started off in the last couple of update reports with a bit of context about the delivery of affordable housing. And I won't go into that too much because we discussed it at length, but members are aware that the registered provider sector, who are the main deliverers of affordable housing, has been financially constrained over the last few years for a number of reasons which we've gone into, and this has impacted particularly on Section 106 delivery and by which I mean affordable housing delivery. There's a planning obligation on market schemes and smaller affordable housing developments. In fact, just as a bit of information, this is a national issue, and the Home Builders Federation has stated in 2024 that at least 13,000 Section 106 units with detailed planning permission were currently uncontracted with the registered provider. So it's a big national issue, but it certainly means that we've had to take a slightly different direction to what we anticipated when we started on this journey with our enabling strategy. The budget has been announced. It wasn't announced at the time of the report was published, but it has been now. and the government has announced an immediate 500 million for the current affordable housing programme, and has agreed the principle of a 5-year rent settlement moving forward, which provides security for registered providers, something that had been going on, asking for a while, and provides a detail of security for their funders. So we move on to our delivery in respect of the plan and the targets. I think it's useful just to, certainly at table 2, you're going to look at the actual target delivery over this year and next year, but I think it's worth just talking about some of the things we've actually been doing, which we probably don't talk about as much, because we ask this sort of tends to be quite formulaic in terms of the goals we set out and the strategy, but I think it's useful just to focus on what we've actually been doing, the news behind the headlines, if you like. I think over the last 6 months, one of the main things we've been looking at or working on is the affordable housing, the local authority housing fund delivery programme. Now, this is a council-owned programme where we're bringing into ownership council housing, which is a big leap for us because we've not owned council housing for a long time. And there's a lot of infrastructure around this, including registering with the regulator, for example. It's setting up the sort of operations behind it, collecting the rent, going to the property, making sure the compliance tests are done, etc., etc. And to allow us to expand our operations as a council, we've also got a sort of tender brief prepared to seek further operational management support should we need it, because we don't at the moment have a management service as such. And we've acquired a couple of dwellings already, both of which are let, and we've offered on a further property, and we're looking to, and had the offer accepted, and we're looking to offer on a 4th property this year. The Local Authority Housing Fund programme, which we'll cover more in the confidential section, is moving forward, and we'd take up further opportunities should we have that. We've also worked with a local registered provider to undertake a feasibility on a site where the council has an interest, and we're also commissioning a second feasibility on a site owned by the council, so that will be progress in terms of our delivery moving forward should those come into play. We have brought together parties to actually against the direction of travel in terms of Section 106 units, but we think we've brokered an agreement to a registered provider and a developer in the city to bring forward some affordable units that have been unplaced for quite a long time. So that's a good news story for us in the city. We've also worked over time, perhaps starting off before my time, to bring forward the 125 affordable units on what was previously stored site at University Park Drive, which is a 100% affordable site delivered by Stonewater and formed most of the completions of the last financial year, something spilling into this financial year. So that's good. We've also, the whole issue around Section 106 delivery, it is a national issue. And Home Builders Federation, some house builders are saying, well, if we can't sell these affordable units to a registered provider, we're either going to set up a registered provider ourselves, or we're going to push for a commuted sum for the local authorities, the local planning authorities to take. So it's been a big issue because nationally, Section 106 sites are the bulk of affordable housing delivery comes through the planning process. So the fact at the moment this isn't happening, it's not such an issue in Worcester because we don't really have that many Section 106 sites, but in terms of our nominations over our borders to our partners in South Worcestershire, clearly that's where the big developments are, and in terms of the local plan review, that's where the new large allocations are going to be. So we need to be sure that we are working strategically now to make sure that we have a plan B, or make sure we have partners in place that are going to take the Section 106 units. I think everybody's been caught on the hop by this because it was slightly unexpected, and that's nationally. So we just need to make sure that that's what we're doing, and we're engaging with our partners, and there was a meeting in Wychavon yesterday on this very issue at a fairly high strategic level that I was unfortunately unable to go to. So that's where we are in terms of what we've been up to in the last 6 months. We move on to goal 1, which is probably the big goal in terms of, what is the big goal in terms of target delivery. Again, table 2 sets out our delivery, both historic and projected delivery moving forward. So you can see how we're doing. And for a city, you know, we are very ambitious in terms of our delivery, and certainly the housing enabling strategy was very ambitious. But in terms of our actual delivery for a small city, it is, you know, we're not doing that badly if you compare us with some of our contemporaries. And also in terms of I had a look at house building starts and completions over the last few years. You know, as a city overall, 22-23, we delivered 390 units. 23-24, 360 units. 22-23, 420 starts. 23-24, 180 starts. So actually, we're delivering consistently over 100 affordable units a year in the city. That's pretty good, actually, and something, you know, we should take credit for, all of us. But in terms of, just to go back to in terms of this year, we've already completed 48 units in the city by quarter 2, and we're anticipating 167 completions by year end. A majority of this which will come from the Broomhall Way site at St Peter's by Rooftop Housing, which again is a 100% affordable housing site, which is good. It has been delayed slightly, but we're getting the units this year, so that's good. In 2025, we're projecting 85 units in the city, which is a dip down. There's a possibility of a further 84, but we suspect these are going to slip into the year after. But we'll keep an eye on that. And obviously anything we can do in the interim this year to increase our delivery will be good. In terms of the strategic sites, the urban extensions, we measured delivery of the affordable units where the council has nomination rights, and these are continuing nomination rights. So it's increasing our portfolio of stock through the Housing Accord. We're only anticipating 8 units to be delivered this financial year. But we should receive 149 the following year. It's worth noting, said in the report, there's a couple of schemes we were anticipating coming through, all affordable schemes that haven't come through. And this is really, it's a sort of strategic delay, deferrals because of larger sites coming forward and the impact on highways of bringing forward smaller sites independently. So they've been shunted back, and this is the nature of large-scale development. Things inevitably are delayed because there's so many parties involved. There's utilities, infrastructure, there's highways, etc. There's funding, there's viability, and so on. And there's, you know, different ownerships. So that's where we are. I think that's the main goal, really, that's of interest. But I'll run through the other goals as well. Clearly. Goal 2 is simply about the strategic and enabling function, and we've had our small team in place for a year now, and this is what we'll be looking at in the next 6 months. You know, the affordable housing, the local authority housing fund acquisition programme. We'll also be looking to deliver further acquisitions where we have the opportunity. We need to do it where we are doing a couple of feasibility studies, and possibly beyond that to concept design on a couple of sites, certainly on one site, so that we are ready should financing or partnership opportunities come our way. It's not no point, oh, we have a site, without any sort of feasibility around it. So that's what we're doing. We continue to work with our neighbours to negotiate affordable housing on strategic sites, and obviously with the development plan review, there's 2 other strategic sites, namely Worcester Parkway and I can't remember the other one now. where there is a new accord, a new accord will need to be put in place. And again, progress actions within the Worcestershire housing strategy. In terms of Goal 3, I mean, the main focus on that is the Affordable Housing Working Group, which is established and works well, and we have buy-in from corporately across planning, legal, finance, property, etc. So that's working well, and we work quite collaboratively. Worcester Housing Strategy, Tom probably knows a bit more than me about what's happening, but I've attended a work stream on it, so something's happening. The temporary accommodation review, which is also part of this goal, quite sure why, but we have, well, not myself, but Rose and Tom and the team have brought a number of units into play, which has reduced our reliance on sort of bespoke temporary accommodation, which is what we're aiming for. We have new units at Park Street, which are coming on stream in early next calendar year. So I think once those are bedded in, we'll have another assessment of what our needs are. It's difficult at the moment because we have another 8 units to come into play, and when they're into play, we're better placed to understand where we move next. Because obviously our goal is to provide sustainable temporary accommodation and reduce our reliance on third parties. We have a registered provider liaison group, and we do speak at high level. I mean, there's not a massive engagement with registered providers on a day-to-day basis, to be honest, because there's not really a lot going on from their point of view in the city. We're also working with Sanctuary on the ex-swimming pool site, which will come through hopefully next financial year. So we engage with them. But, as people come into the city, we are working more and more with different types of providers. And I think when we go into the confidential session, I'll be able to talk more about some of the conversations we've been having. We meet with Homes England. We met with Homes England recently, and their growth manager is coming down to the area with us in a couple of weeks' time. And he seems very supportive of the area and some of the ideas we're coming up with in terms of a lot of around the acquisition side. Homes England have always been traditionally slightly not opposed to acquisition, but it's not part of their main programme. But I think that if we're looking at sort of specialist sort of acquisition and, for groups that we're struggling to house through mainstream SOC, I think then there is an element to be, they will be supportive. Goal 6, we continue to raise affordable housing as an issue, as do members. It's clearly a big issue, a priority for members. I think the last 2 goals, land promotion, we have the sites identified through the local plan review. We don't really own any sites. There are some large sites in the city which are struggling to come forward, which we are engaging with the owners. There's the Shrub Hill Master Plan, of course, which is ticking along as at its, but that's some way down the line. And in terms of opportunities for joint working, it's there and it's something we'll still look at, but I think that what we've learned over the time is that the council needs to take more of a leading role, which is difficult given our financial pressures, etc., but we are starting to put the infrastructure in place to begin to deliver more ourselves. Probably not, as I've said time and time again, it's probably not what we expected to do. It certainly wasn't what we expected to do before my time, but when the Housing Enabling Strategy was written and envisaged, but we are reacting to the climate we're within. So that's the reports, and I'm happy to field any questions.
Thank you, James. I'll take questions. Councillor Lawrenson first.
I really do sympathise with you. You have a somewhat thankless task a lot of the time because you're going out there, flying the flag for the council, going to registered providers, and saying, you know, can you invest more and build more homes? So I just want to thank you for all the work that you are doing to make that happen, because it seems every time that you come to give us an update, it's the same challenges that you're having to deal with. And I have got a question, I'm not just rambling, I promise. My question's about the registered provider liaison group, and the meeting, so you and council are meeting quarterly with registered providers. I just wonder whether there's much value in having these meetings, given that in the action plan on page 4, you've acknowledged that registered providers are not proactive in the market and are reviewing growth strategies due to business plan constraints, aka they're not keen on building affordable housing. There's then on page 4 in the action plan about revising the target date to July 2025, which relates to working with smaller third sector organisations and private providers. So the question is, do we bin the registered provider liaison group and instead invest more of our time and effort into working with smaller organisations so that we are going to have more affordable housing? Because it seems to me like you're banging your head against a brick wall with the bigger registered providers, and there's more potential in smaller organisations that might actually build homes. So are we going to eventually get rid of the registered provider liaison group? Because it seems to me that you're repeating yourself and you're not getting the answer that we all want.
Yeah, I can.
Yeah, I'll go first. I won't quite say great minds think alike, no, but okay. But the point you mentioned is absolutely the point that I've been on from day one, in terms of that we had a habit at the start, and we continue to have that habit of going to the big registered providers in terms of that, and they've constantly refused us. I think we know the reason why. James has explained in terms of they were holding off, waiting for a change in government. The promise is there now, obviously support, but hopefully that will be the catalyst for them to now take action and, you know, start being active in the market, although I don't hold up too much hope. But in the meantime, we have been ignoring the smaller ones, the smaller opportunities, the 1 or 2s here, the 4 and 5s here, 6 and 7s here, that could have accumulated and made a significant number in terms of that. Hopefully that those opportunities will be explored now. And I'll hand over to you, James, or Lloyd.
Yeah, I'm happy to respond. I think it needs to be both. I think it's important not to forget that the 4 or 5 RPs that we meet with on a quarterly basis, they've got several thousand properties in the city already. So maintaining that relationship and, you know, keeping those relationships in a good place is worthwhile, albeit, you know, the challenges have been set out clearly. But there's definitely been a sort of a sense of looking more locally at those providers that are actually within Worcester as well. So it's a both approach for me.
Could I just add as well, Chair? I think the liaison group isn't just about development, as Lloyd says. We deal with a lot of sort of operational management issues as well. And in terms of, although our city isn't rich picking, shall I say, for our, you know, larger registered provider partners, we also have a relationship with them outside of our boundary in terms of the urban extensions coming forward, where we will have nomination rights. So we do want to maintain those relationships. And we have a new government in. There's been a lot around Section 106 or lack of delivery on Section 106 and smaller sites. So hopefully, and that's gone up through the LGA nationally to government. So hopefully there'll be some stick as well as carrot to push our, you know, strategic partners into, you know, looking at some of the more difficult sites, smaller sites, as part of their overall programme.
Thank you, James. Are there any other questions? No. I mean, what this does, I mean, thank you, and I'd like to extend the thanks that Councillor Lawrenson has actually. What you don't fail to appreciate is actually the amount of legwork and effort to kind of build the infrastructure and the base to kind of to be ready to pounce from in terms of when that opportunity kind of comes. And it's taken this long for us to kind of develop that, understand the landscape, what we're working in, what the constraints are, what the opportunities are. And what I can say is obviously the news that you've given us, obviously, in terms of the small progress that has been made is, although it may not seem on the face of it significant, it is great progress and it is still progress. So we are moving in the right direction. What I do hope is obviously when the opportunity does come, we're ready. We don't have any excuses not to kind of move, and hopefully we can, if that pace needs to quicken, and if that sports needs to be there in order for that pace to be quickened, we need to know about that and how to enable that, if you see what I'm saying, because obviously the new government is in place. There is huge talk of obviously the surrounding in new towns and the thousands of homes that need to be built in terms of that, and there will be opportunities within Worcester in terms of that, and I just don't want to miss that opportunity when that opportunity comes. So do whatever you can within your power in order to be ready to pounce for those opportunities, and whether that means talking to those smaller providers and the smaller numbers, working from on that, and if that needs political will or help in order to achieve that, don't be afraid to ask for that help. But thank you for your report, really appreciate it. And that is for a recommending, is that a noting, isn't it? Is that right? Yeah, so that's, we're happy to note points 1 and 2 on that report. Board agreed, thank you. Thank you, James. Okay, we have agenda item 11, housing benefit subsidy loss. Tom?
Thank you, Chair. So I'm conscious it's quite a lengthy report that I've produced for committee and is quite technical, quite technical area of work actually, and hasn't previously been presented to this committee before. The intention of the report, it's an information report, and it's to introduce housing benefit subsidy loss to members of the committee who may not know anything about it or know the detail that lies behind it. And the intention is to use the report as a sort of point of reference, hence the level of detail that's contained within it. And to try and explain the concepts behind that lie behind housing subsidy loss. It's also intended to outline the subsidy loss for the full financial year 23-24, and the intention is to bring back an annual report covering housing benefit subsidy loss, with a particular focus around temporary accommodation, where we have the most input and impact and control over housing benefit subsidy loss to the authority for this committee moving forward. So hopefully this will be a useful document to provide some background and explanation as to what housing benefit subsidy loss is, how it's accrued, and what the impact on the council of it is. So I'll try and summarise a few key points, and then obviously happy to take any questions rather than going through the report in any great detail. But subsidy loss is accrued from two primary areas. So temporary accommodation, so that's the accommodation that's provided by us to fulfil our duties under the homeless legislation. So that can feature a range of different types of provision. Bed and breakfast could be provision that's managed and owned by the council, range of different types. The second area of subsidy loss, where subsidy loss is accrued, is supported exempt accommodation. So that's accommodation which is provided either by a registered provider, housing association, or a private provider, and essentially there's support in place at that provision. So it's supported accommodation, and the intention is that that's there for people to then move on into independent living. Housing benefit regulations set the maximum subsidy that could be claimed for each type of provision. So we're constrained with the regulations that are set around what we're able to recover from each of the different types of provision, which is where it gets a bit complicated. The temporary accommodation maximum subsidy levels are based on the local housing allowance rates from 2011. So they're somewhat outdated. So there's been a revision to the LHA rates in sort of general needs accommodation recently, but the LHA rates for temporary accommodation still remain at 2011 levels. And obviously, given the increase that's been since then, it's somewhat behind the cost of more general needs accommodations. We're working on that basis. We can only claim subsidy for temporary accommodation rent up to that maximum subsidy level. So the maximum we can claim per property for temporary accommodation is £103.85 for a one bed. But that's somewhat behind that sort of general needs accommodation. There's different regulations that apply for supported exempt accommodation. For registered provider managed supported exempt accommodation, we can claim 100% of the rent charge, and there's no subsidy loss that's incurred for that type of provision. If it's not owned or managed by a registered provider, we only can claim a lot lower amount of subsidy. And again, I won't go into the technicalities of it, but it depends on the level of support in place and the level of vulnerability of the individual that's accommodated there. We have fairly limited control over supported exempt accommodation provision, and in particularly private accommodation in the city. But we do have more control over temporary accommodation, which is where the majority of subsidy loss is incurred for Worcester. Around supported exempt accommodation, the housing team works very closely with our Revs and Bens teams. So when a new provider may be looking to establish themselves in the city, they'll liaise with us and we'll discuss that provision. There's also been the Supported Accommodation Regulatory Oversight Act, which was passed, which will give local authorities a lot more control and oversight around quality and the nature of the supported accommodation provision. It's something that's been lacking for some time. So will give us greater powers. We're just waiting for guidance to be, or consultation to inform what the guidance will be around that piece of legislation. So what that looks like, but it will create both responsibilities on local authorities for undertaking inspections and quality control and things of supported exempt accommodation, but will give us a bit more control. The most cost-effective model of temporary accommodation is shared accommodation, which is owned or managed by the council. We incur zero subsidy loss against that type of accommodation. And in fact, we can actually generate an income from that potentially. So we set the rents at the LHA rate, and we can potentially generate an income as a result. The impact, however, does come from the cost of additional resource. We then have to manage it. We have to do all of the compliance around that provision. And we also hold the risk. As you might imagine, the nature of people that need temporary accommodation varies quite significantly. People facing multiple disadvantage for various reasons, families, single people. So the spectrum of people that we have a duty to accommodate varies. And often we have to be very careful about what the mix of that accommodation looks like and where people are placed. So the least cost-effective model is private bed and breakfast or hotel accommodation. We use very little hotel accommodation now, particularly sort of independent chain type accommodation. Up until probably 18 months ago, 2 years ago, we did rely on that fairly heavily, which is both expensive, it's not as suitable for anybody, much more difficult to manage, it's sort of individual bookings, so creates all sorts of problems. The non-procured provision, so that type of provision, the sort of main sort of high street brands that you might know, incurs the highest level of subsidy loss. So again, it's most expensive to the council. So we have we undertook a programme of procuring sort of privately owned temporary accommodation where we had such a demand to access that. So that does still incur a significant subsidy loss, but we have much greater control around negotiating the cost, monitoring the quality. We can check that it's well managed, and we have a greater oversight of that provision. We also have control over who's placed there, whereas just sort of spot purchasing hotel accommodation, we have no control over who else might be in there, so it does make managing risk very difficult. A range of interventions have been undertaken to reduce the impact of temporary accommodation on housing benefit subsidy loss, particularly around the reduction in the use of more costly and private B&B. I haven't got the exact figures of how many bed spaces we've used for that type of provision, but it tends to be very short term, only in an emergency when nothing else can be facilitated on that night. So for instance, out of hours, if we can't access accommodation, it might be a night or two. Alongside this, significant progress has been made around the use of temporary accommodation. We've been really successful in reducing the numbers. I can't take any credit for it. I'll give full credit to Rosie, who's here this evening, in reducing the number of placements. So in 23-24, it was a 32% reduction on the previous year, but we've continued to see an ongoing reduction in the number of households placed into temporary accommodation. And that's not any form of sort of gatekeeping or not providing it for people that we have a duty to accommodate or need that provision. It's very much driven by the focus of the housing team on prevention, so where we can keep people in their tenancies, look to move people directly into alternative accommodation, and essentially reduce the need and the reliance on having to go into temporary accommodation, which we know has significant impacts on people. So whilst opportunities have been identified to further reduce the use of private provision where higher housing benefit subsidy loss levels are incurred, there'll always be a need for that type of provision, and there'll always be a reliance to some extent of using that. So whilst council owned and managed temporary accommodation is cheaper, there will always be a need to have some degree of private. And I think what we want to move towards is sort of getting the right balance of some accommodation which might be managed privately and some accommodation that's managed by the council. So the expenditure, all the details around the expenditure over the course of the year are included in the report. In 23-24, the total expenditure for temporary accommodation was just under £768,000. Of that, the council received £321,000 in subsidy, so the total subsidy loss that the council incurred for temporary accommodation last year was £446,000, which equates to a subsidy loss rate of 58% against the expenditure. So we have to pay out, and it's what we were able to reclaim back. And temporary accommodation accounted for 63% of the total housing benefit subsidy loss. The subsidy loss arising from supported exempt accommodation amounted to just under £274,000, which accounts for the other 38% of the total subsidy loss. The total, therefore, housing benefit subsidy loss to the council last year was just short of £720,000. and hence the reason to sort of make this committee aware of the impacts that it has on the council finances. There's a more several tables contained within the report which are probably quite useful points of reference. In the summary at 2.3, it just gives a breakdown of the types of accommodation, so not the individual buildings, but the types of accommodation, the different types, and how the various different subsidy levels are impacted. So where that subsidy loss has been accrued. We've identified a number of areas that we can take to intervene to try and drive down the level of housing benefit subsidy loss. Some of which is been done, some of which is in motion, as I've already mentioned, around the focus and shift towards prevention, the move away from the reliance on private bed and breakfast, more expensive accommodation. And we've developed a sort of action plan which is outlined in Appendix 2 attached to the report. I'll finish there, Chair, and take any questions.
Thanks, Tom. Apologies to Rosie. I'll blame Tom on the order of this paper being last. You know, we need to sort that out, right? In terms of that. On a serious note, obviously, I think I was one of the ones, along with some other members, to called for this about a year ago in terms of presenting to us the understanding breakdown of what it's actually costing us as a council in terms of temporary accommodation and the lack of funding that we get to truly understand. I was on an LGA finance course on the weekend, and somebody mentioned obviously temporary accommodation and that one of their ambitions and the fact. Sorry. Let me rephrase that. They mentioned temporary accommodation, and they mentioned the fact that actually a child in temporary accommodation was 5 times more likely to die. So I went back and Googled that and tried to find out as much information. And since 2019, 55 children have died in temporary accommodation in the UK, and most of these are under 1 year old. This is in temporary accommodation, which is an absolute shocking fact in terms of in a first world country, again, in terms of people's quality of London standards that are living in these accommodations. So it's absolutely essential that we reduce the number of temporary accommodation units, not only from a cost perspective, but just preservation of life. Absolutely preservation of life. It's absolutely shocking. And I'm certainly determined, with James's help and with other people's help, to make sure that we do something about it in terms of reducing that over the next few years, in terms of that. And Tom's already mentioned about actually some of the quality of the accommodation that we've secured privately is much of a much higher and better quality standard. We can control, we can dictate, we can enable, we can ensure that the accommodation that we're procuring must be set at a much cheaper rate, or a better, more rate than that we're getting from B&Bs, and to save on costs as well. So it's absolutely the right way to go. I'll open this up to the floor now if anybody's got any questions regarding it. Councillor Mace?
No questions, only really comments that, compliments to Rosie and Tom and the team for the work to reduce the amount of temporary accommodation needed. And I think there is a lot of detail in this report, but it's absolutely clear that we save the most money by procuring our own accommodation, and that's much better quality, as you've already said. So, more of that, please, more of everything you've done so far, because it's been really great. Thank you.
Thank you, Councillor Woolmore.
I just want to place on record as well my thanks to the teams. Rosie very helpfully supported me with a case last week of a young mum who was in an enormous amount of distress, and the vicarious sort of trauma of dealing with people like that day in, day out, I'm sure is, you know, really can take its toll. You know, you're dealing with people when they are probably at the lowest point in their life. And so that, you know, the work that you do, the service that you provide and the help that you give us to support our residents is just so hugely appreciated. So I know it must be incredibly tough, but, you know, really thank you for all the work that you do.
Thank you. If there aren't any further comments, I think the item is for noting. Councillor Holmes, yeah.
Thank you, Chair. I recently had the privilege, the city sent me to the LGA conference, and it was definitely a hot topic there, and a lot of other councils are really struggling with this topic, and it's bringing them their budgets. Well, so we're actually reversing that trend here, and I'm very pleased to see, and it's to the improvement of the people as well, you know, the standard of accommodation. So thank you very much.
Thank you, Councillor Holmes. Any other comments? No? Or are we happy to note that? All those in favour? Thank you, Rosie. Thank you for your patience. Thanks, Tom. Okay, we are in any other business, items involving disclosure of exempt information. Is that correct? All those, Julian? There's no other business that has been notified to me. So we can move on to agenda item 13 then, please.